that we've all been waiting for. The good doctor is in the house. Good morning to you, good sir.
Good morning, sir. How are you doing?
I'm doing quite good.
Okay, very good. Let me say a pleasant good morning to the listeners of Sky 99.5. Well, you're getting a little static though, but I know that's the weather.
Yeah, we're getting some static.
Yeah, you're getting some
My
static.
video is a little bit
Yeah.
static.
The thing
Yeah.
is, when rain fall in Trinidad, it's some things is rolled properly, you know.
Rain has affected everything.
Everything, yeah, exactly. Especially from the perspective of internet and Wi-Fi and those type of things. So again, a pleasant good morning to the listeners of Sky 99.5. I hope everyone is safe. Those of you who on your way to church, you know, you need to be very safe out there on the roads and that type of thing. So, of course, as usual, we're discussing health from a natural and integrated perspective. As usual, our program is interactive. So, if you have any questions, any follow-ups as regards to what we do at Batson and Associates, feel free to give us a call or message us. We will be entertaining questions from all aspects, and I'll try to, accommodate as much persons as I can, so that you, of course, will have the experience or the explanation as regards to your particular issue. Always keep in mind that even though, I try not to really give, I try to give general advice as regards to what your issue may be. Keep in mind, we always need to be responsible, and whatever tests you need to do, if you have blood tests, if you have CT scans, if you have MRIs, and you have to understand, especially if you have injury of sorts. I mean, I know everything is a financial consequence, and we have to take money into consideration. But the problem with a lot of y'all is that sometimes things start to go wrong with you, and you could have go and check. I mean, you could still go and pay to do a blood test in maybe a private lab or something. Don't wait on the hospital. I mean, if you have no other choice but to wait, well, then you have to wait. But a lot of times you could do it for yourself, and that will save you some time, because a lot of times when you're dealing with health issues, time is usually against you, because at the end of the day, you need to get things done, and get to the root of the issue quickly. As the old people say, you want to be more proactive. Well, it wouldn't be proactive if it already happened, but the thing is, you will be more at a better position to really have a better control of the situation if you get onto the situation earlier. So that's what I'm trying to say. So men, if you need to do your little prostate tests, there are exams that you have now. Nobody don't have to do any digital exam. It have no finger business involved. There are some people, and there's varying schools of thoughts as regards to prostate examination, but there's something known as a prostate ultrasound. You have transrectal ultrasound, which is a little more uncomfortable, because that's actually they're going to insert a probe into, and with that, as they call it, transrectal, they're actually able to see back and front. So they're able to see the top of the prostate, the back of the prostate. They'll be able to see, so if you have an issue, they're gonna pick it up, because you see the good thing about radiography and radiographers and sonographers, the thing is, you don't want to do too much x-rays, and you don't want too much exposure to radiation. We know that, right? But there are times when, in order to find out what is wrong with you, you're going to have to do a test. Like, for example, CTs. CTs are what? There's basically x-rays in three-dimensional, all the way around. So you get a picture where, when you do a CT scan, which is usually is one of the most respected forms of diagnosis in medicine, or diagnostic equipment, because of what it is actually able to do, right? So keep in mind that those are things that if you need to do it for yourself, you need to pay attention to yourself. Let me make our next point too as well. The eye people, listen to me. Always see that eye hospital and eye clinic that they have. I don't know if you ever went to the eye clinic, right? That eye clinic has some work. Let me be nice. It has some work to do. So with that being said, is a crowd of people. There are a lot of persons there. That's our next thing. If you could go and pay and do your little eye test, do your test seminar, please. Please. Because I have known of persons who ended up blind waiting to go and do testing. And you could have very well go and afford and go private and do your test. Eye test, OCT scan maybe about what? I'll have to find out, but I know it within range. Right? I mean, everybody's circumstance different, but that's just what I wanted to share with you guys this morning, because I found a lot of persons, sometimes a little too late, and it could have been avoided. All right.
Yeah.
So with that being said, this morning's topic, we are discussing, I'm going back to the topic of dementia because I think there's a big topic. We're going to touch on Parkinson as well. So we're going to look at diseases or imbalances of the central nervous system, musculoskeletal system. We're also going to discuss epilepsy and fits because that I think is a big issue now. A lot of persons who, you are going fine, you're an adult, you're in your 20s, in your 30s, and then all of a sudden you start to get fits or bouts of epilepsy. What causes that? What to look for? What is your body telling you? If it is you start to experience fits, if you start to experience various aspects of epilepsy and that type of thing. So those are some of the things we're going to speak about. Of course, keep in mind we are live on Facebook. On Facebook, we are Batson and Associates Limited. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Let me say pleasant good morning to our Facebook audience. We have Miss Helen Marshall. She says, blessed morning, Dr. Batson. We have Miss Rosalind Noel. She says, good morning. She says, Dr. Batson, someone told me if I put a little tip of salt on my tongue before drinking water, it helps against thirst. And that is not really a good idea. Not a good idea at all. Don't take that. That's bad advice. Why you want to be you see, the thing is, the reason why they tell you that is because sodium affects your electrolyte balance in the body. Sodium, potassium, magnesium, calcium. Yeah. So the thing is, you don't want to. I was actually looking at an article recently that someone wrote, and they were talking about drinking too much water, and I found it so ironic. I said, these people, because there's a big disagreement with the article, a huge disagreement. I said, these people and them really have nothing to do when they come in. You actually tell me somebody actually sit down and wrote an article about people drinking too much water? Which world they living in? Where they see that? That's not happening. That's not happening. That is bubblery at its highest degree. I mean, there are instances, as I said, if you are a kidney problem patient or you may have certain health issues that may warrant you watching the amount of water that you're taking. But usually, people who end up with kidney problems is because you were not drinking water in the first place. So it's the dehydration what got you there in the first place. So please, try your best and drink as we normally advise you, your body weight divided by 2 in ounces, because that application, because even in that article, they didn't even itemize or highlight, that water is individually and depends on, your individual circumstances. If you're working in the sun, if you're a mason, well, we are rain these days, but if you're in sun, dry season, you're going to be drinking more water. If you're exercising, you're going to be more thirsty. If the place is hot on a particular day, you're going to have more evaporation. You're going to sweat more, which means you're going to need to drink more water. I mean, simple common sense. But when we're looking at the basic aspects, that's what we're looking at. Okay, so of course, if you have any ones on the line, you let me know. Let me say a pleasant good morning to Miss Roxanne Herbert, Miss Anne-Marie Bob, Miss Jessica Clark, good morning to you. Miss Elizabeth Nandler, pleasant good morning to you as well. Good. So, Parkinson. Parkinson is primarily a neurological disorder that affects a number of different aspects in the body. So, it interferes with motor skills. It interferes with certain aspects of your cognitive function. So, someone who has Parkinson, now there's Parkinson and there's something known as tremors. So, people with Parkinson would usually have some tremors. They tremble, their hands shake. You might find their head have a specific, like that dashboard rather, puppy kind of finish. Yeah, and that is not, and some people think you're being facetious when you say that. There are people who actually go like that, And that is a serious problem. In fact, I know someone who I observed it from since as growing up, knowing the person, and it's really bad now, really bad. So that's something. If you do not deal with it and address it as early as possible, you're going to end up in some problems. Good. Yeah. So when we talk about Parkinson, though, Parkinson, unlike tremors are just the trembling. And the thing is, people with tremors do not have shaking constantly. It's almost a sort of anxiety shaking when they're in circumstances, and that anxiety comes on. So, for example, if they have to write, so if they go to the bank and they maybe have to sign, because they automatically in their mind is like, oh my God, I have to sign, people looking at me. So that whole kind of anxiety, stress is the stressor that actually brings on that tremor. So with tremors, the issue is bad, but it is not as bad as Parkinson, because Parkinson involves not only the tremor situation, which could be quite involuntary. Well, it is involuntary, but consistent over a period of time and does not necessarily require a stressor like the tremors when you're signing a document or something like that. The thing with Parkinson as well is that you have some aspect of neurological, I wouldn't say damage, but neurological incompetency, where you're not, your cognitive function, place and time, which is why diseases like Parkinson, Alzheimer's, and those type of diseases primarily fall in the same category where they affect the central nervous system. So with that being said, what are some of the things that you need to pay close attention to? Now, your memory is one, and I always tell persons, some persons' brain work differently, obviously, in terms of how you remember things. So for example, some people are very good at sequencing in terms of how they remember. So some persons remember numbers very well. Some people have a knack for remembering faces. Some persons would not necessarily remember your face, but they remember your name. It has some people like that, you know, they remember names like that. So you have different, and sometimes that's how you're trained or how you train yourself growing up. Maybe if you are a reader, and then it depends on the type of learner that you are. Some people are audio learners, so they learn, like I am like that. Anything I hear, I do forget. And then you have visual learners, which people you have to see things. Then you have kinesthetic, where they actually have to practice and participate in how they learn. So those things would factor into how one's memory is affected. But you always need to pay attention to your memory, especially short-term memory. And of course, when you start to get in those golden age or the golden years, you want to ensure that you are proactive as opposed to being reactive. And that's one of the things that a lot of persons do not understand, that you need to really have a plan as you get older. In the sense that, you know, and that's like when I gave the program, I had a program this Thursday, I spoke about hormonal imbalance in women. And I was saying that because I was discussing PMS and menopause and that type of thing, and I was saying a lot of women do not understand that when you're going through menopause, and once you're alive, your hormonal aspect in your body needs to be taken care of. So you see, the thing is, a lot of persons do not understand in the spectrum of nutrition, especially clinical nutrition, which is nutrition for disease, and understanding that the body and any type of disease primarily is an imbalance in some aspect of your body. Some easier to figure out than others, but I mean, I'm not tooting my own horn, but I got some people who nobody could have figured out what was wrong with them. And in 5 minutes, that was it. And that's because you're looking at the root cause of the problem. So when you're looking at neurological imbalances, you're looking at things like Alzheimer's, Parkinson, you know, dementia, which I think dementia is one of the worst to see. Dementia is worse than Parkinson, in my opinion, because people with not Parkinson, sorry, Alzheimer's, as opposed to dementia, because dementia tends to be a little more violent in the sense that people with Alzheimer's usually they calm in their whole disposition, in the sense that Alzheimer's people usually not aggressive. They'll go into the bouts where they forget time and place. You might be a family member, a child, spouse, and you're right in front of them. They're not recognizing you. You had a conversation earlier about the teacup, and then 5 minutes after they start talking about the same teacup. That type of thing. But what you need to really understand and pay very close attention to is that with those aspects of neurological imbalances in the body, it means you need to feed your body in such a way that you would have better memory. Feed your body in such a way that you would have better sleep. Feed your body in such a way that you have better concentration. Feed your body in such a way that, and this is not something to be tabooed or feel any kind of way. As a male, you know, I don't know a man who doesn't want to be virile and properly functioning. Feed yourself in such a way that you have a proper male function. Feed yourself in such a way that as a female, you know the PMS situation, the hot flashes, all these type of things, the memory problems is not affecting you. So think about it like that. And a lot of people don't think about it like that. Because every nutrition has a specific way in which it affects the body. So let me give you an example. So vitamin A. We know vitamin A carries everything in the universe operates on something known as frequency or vibration, right? So the frequency of vitamin A has the same frequency of your eyes. The frequency associated with calcium has the same frequency as your bones. So the thing is, the point I'm making is that when nutrition is concerned, nutrition is more in depth than people really understand. But once you get it correct, listen to me, people want to know what's going on with you, They say, nah, man, like you ain't getting old. Yeah. So we have some questions? Good.
Yeah,
let's go.
Some questions coming in. Someone is asking, well, while you're on the topic of nutrition, someone is asking, good morning, my question, doctor, today is, are there any special diets for dementia and Alzheimer's patients?
Yes, there are. Definitely. And we have those and we could always tailor them. Listen to me, you could get a special diet for anything. Anything you could get a special diet for. And that is what I'm saying in the conversation. And you see, it is quite unfortunate, but the good thing about it, we live in the information age now. People getting more aware of certain things, and it's always good to be a reader. Even though, well, the good thing they have audiobooks now, which was the greatest creation in my opinion. So I don't read anything. I just press a button now if I'm going in the car or when I'm lying down, whatever the case may be, and I listen to as much as possible. And that says work. Even though I would read, because I believe reading in itself, it does something to the brain. It stimulates that whole mental, visual connection. I think is very important to learning and that type of thing. So I'm not bashing the reading, but as I said, you have to know the type of learner that you are and how you assess and assimilate information as opposed to somebody else. So yeah, definitely. So you could create a diet. Cancer diets are very, very important. I'm very good at those. I always appeal to people, regardless of however you look to deal with cancer, whether you're in the Western medical way or you're deciding you want to do something alternative or you're doing chemotherapy, radiation, whatever you're doing. Because you see, it always comes down at the end of the day to choice and personal choice. I remember in the height of the pandemic, I used to have a lot of questions from people as regards to the vaccine. And there were some persons who, for some reason, found my, like I was giving a passive-aggressive answer. But it wasn't anything about passive-aggressive. It was just a matter of letting people know that in the final analysis, that is your personal choice. And that still remains my opinion where that is concerned. So any medical, anything or any surgery that you are being told that you have, in the final analysis is a personal choice. Personal choice leaves you when, and this is what I want you all to understand, that people don't really grasp now. There's a saying, do not give your power over to people. Yeah. People don't understand a lot of things what that means. When you neglect your health, when you ill-treat your body, you play the fool, as the old people say, you play the thing with the tail. You put yourself in a situation where you no longer have choice. I'll say that again. I want you to understand. I want you to resonate. I want you to understand what I'm saying to you. When you ill-treat your body, when you do not take care of yourself, when, as I said at the genesis of the conversation, when you do not check intermittently, you don't check all the time, you can check 6 months, every year, 2 years, that kind of thing. I have clients who have been with us since 13 years, from the beginning, the inception of my business, which went through so many different changes. They could tell you about that time I wasn't Dr.Batson. I was far from where I am today, thank God. But you could always better your best. But the point is, what they realize is that when you do certain things as regards to that particular aspect, is that you put yourself in a better situation. Yeah. Do not hand your power over, because when you're in a situation, I'll give you a quick example, and we're going to start to take the question. Women who have problems with their menstrual cycle. So think about this, right? So you start off, let's say you start to see your menstrual cycle. This is much older women. So they would have started, not like these younger girls who started in 8 and 9 and 10. So people like my mother and my great-grandmother, and then they would have started like 14, 12, 16, all around there. They would have started seeing the menstrual cycle. So imagine you have females started seeing your menstrual cycle, let's say 16 years. And from the inception of that menstrual cycle, or maybe 2 years after, so at the age of 18, your cycle started to give you problems. So you start to get a lot of heavy bleeding. You're getting a painful menstrual cycle. So on a scale of 1 to 10, 10 is the worst. You're taking painkillers. Your period's supposed to come on the 7th. You're taking painkillers from the 1st. Right? That's to tell you how things bad with you. But listen to me. So understand what I'm saying. So at some point in time, let's say you reach age at 20, 21, it going on, 22, 25. You ain't going to see about that yet. So, okay, so let's say for argument's sake now, you went. But the advice that you get was bad advice, which is, believe me, plenty of ladies get bad advice because it's quick to tell you, cut out your womb, you don't make children, whatever the case may be, and a whole bag of foolishness, which I'm in total disagreement with, because all organs in the body have a valid, reason why they're there. Good. So the point is, you left it. So imagine now, you get older, you manage to make 2 children, let's say, so you're in your 40s now, and you have a situation, God forbid you're going home now, menstrual cycle come or supposed to come, and you end up in a situation where you start to bleed profusely. You are home alone, there's nobody there with you. What's going to happen to you? You're going to end up, they go to somebody, you don't know, you might able to pick up the phone, you raise an alarm, the neighbors come, they find you lie down in a pool of blood. But you're alive, so they have to call the ambulance. When you reach to the hospital, what is going to happen to you? So you would most likely be warded. They're going to make the notes, severe hemorrhaging as a result of, they may have some files on you, or they would do ultrasound, whatever the case may be, and realize you have fibroids, whatever the case may be. But the main thing they have to do at that particular point in time is save your life, right? So you lost blood, so you're going to have to get some blood transfusions. But the most likely, after that situation, when you get up, you wouldn't regain and be strong one time, you might spend some weeks there. What do you think the doctor going to come and tell you? Ma'am, you have to do a hysterectomy. So we're going to have to surgically remove your uterus, and possibly, depending on how bad the situation with fibroids, you may have fusing, there might be intramural fibroids, so the inside of the wall, those very difficult to deal with. Surgeons don't like to deal with that at all, I could tell you. They don't want to jump up in that at all because it's too close. Surgeons don't like, when you go in, you want quick work, You want no such a thing and neat cut in here and thing, they got to move nerves, and so surgery is not fun. But the point is, you have reached a stage where you are in an emergency, and when you're in emergency, the doctors, rightfully so, have the say. So that's a long way of telling you, do not give your power up where your health is concerned. Something is wrong with you, especially in the earlies. Go and check yourself. Someone is saying this topic is sensitive for me. Yes, I'm not trying to, because I'll tell you something, even though we started to talk about, the Alzheimer's, the Parkinson, this hysterectomy thing, women understand, for me, especially younger women, understand this clearly. A hysterectomy should always be the utter last resort to your problems. All the ladies who walking around saying they do hysterectomy and they're good, take what I'm telling you, them feel they're good. They ain't good income yet. And I don't say that trying to be a prophet at doom and gloom. People like that, if you do not take care of yourself in certain things, you're going to be in some serious problems. And I'm going to tell you why. Let me give you a harsh reality this morning. One of the main purposes of a woman's uterus is to metabolize fat in her body. I'll say it again. One of the main uses of your uterus is to metabolize fat in your body, and it plays a significant role in circulation in your legs, which is why when women do hysterectomies, one of the first issues that you may have, if you didn't have it, say thank God, something you must either say prayers and you must be eating good and taking care of yourself. Most of them end up with hypertension eventually. And that hypertension that you ended up with was because of the removal of your wound. And I don't care what doctor you talk to. Anybody tell you what I just say is nonsense, tell them I say go back and do anatomy and physiology class. You hear what it is I'm telling you? Don't give up your power. Take care of yourself. The next people is the stroke people. You know you have problems with hypertension. You know. And that's why I always warn people with high blood pressure. Listen to me. Your health is always your responsibility. First man on the ground in emergency is you, You know why? I'll tell you, it's you. Your body speaks to you. A lot of the times, you do not listen. How could you be getting a headache for 5 years? Who is your doctor? You're not coming to Batson and Associates. I guarantee you that. You can't be coming by us and have no headache for no 5 years. Never. I had someone recently. Pay attention to yourself. If you're getting a headache, something is wrong with you. You know there are people who get headaches for long period of time, and when they go and check, you know what happened to them? Is a brain tumor you have. So if you're starting to get a headache, what we in 2022, you start getting headaches since 2018. You're busy, you're working, you're going and do your thing. You might went by 1 or 2 people to check. Well, take some tablet. Nobody will tell you about water. We ain't checking nothing. Because let me tell you something. That tumor most likely was there since 2018. But it must be a small. But you get headache all the time. And God, you know, your situation mightn't be thing because it might be a money situation. Because a CT scan not cheap. A CT scan could be anywhere in the vicinity. A CT scan is anywhere between $8,000 to maybe $15,000. Depending if you're using contrast and that kind of thing, your price gone up. Right? So the thing is, if you're in that situation, that time, you go and check yourself. Cleanse and detoxify. That's the next thing I always tell you to do. If they do not want to come by Dr. Batson, or they find Dr. Batson talk too much, I'm not going to give a man no sale, I'm not going to buy no Santulan, no problem. Go and find a cleanse. It must have a cleanse some way. Mightn't be as good, but you might get a cleanse. But the point is, you're taking preventative measures in what is going on with you. And ask, and listen to me too. It have a few. Dr. Batson is not the only one. Dr. Batson have the way he does his things. He have a particular, I believe everybody have a gift. You ought to know where your gift is. I tell people, my gift is health. My gift is to get people better. I believe that with every fiber of my being. Because I couldn't be this good at what I do. Naturally. It naturally comes to me. This is my gift. Right? So you, whatever your gift is, if you find it, say thank God. But what I'm saying to you this morning, Trinidad and Tobago, the listeners of Sky 99.5, do not give up your power. You know, you have a problem with blood sugar, mind your business. Christmas coming here, do not go and eat everybody thing. You know, you have a problem with pressure, mind your business. Every year, go and do a kidney function test. Do not wait on the hospital to do any tests for you because you're going to get the rude awakening a day where, God forbid, you might take in pain, or you go somewhere and they have to do some check and they test and they say, but wait, you know, your kidney 13%. People just get news like that, you know. But let me tell you something. That news that they get, plenty of them. Put yourself in that. According to my great-grandmother, you buy that wholesale. You know why? Because there are things that you have to understand. I'm saying it again to you. If you suffer from hypertension, you suffer from diabetes. If you have persistent headaches, if you're getting problems with blurred vision, you're getting problems with dizziness. If you have problems with varicose veins, if you have spider veins, and them veins are starting to get big and fat on you, do not tell me nothing but your mother, whose name was Cynthia or Joy or whatever she name was, had varicose veins and you have it now. You are talking nonsense. Your body is telling you that your circulatory system is in a mess. And God forbid, if it gets worse, those veins are going to rupture and you're going to end up with a venous ulcer. Contrary to popular belief, surgically, you cannot strip a vein. You cannot do it. Anybody who do that surgery does always end up in more problems. Go and check if you don't believe me. So I'm saying all of this to say, all your mind, all your business. Pay attention to yourself. You know you're diabetic. Check your eyes every 2 years. Go and pay your money and check your eyes. Your eye. Don't talk foolishly for me, but there's a pension. There's a pension. Good, we know. Think hard, everybody. Save. If you save $50 every month for 2 years, you could go and do a proper eye exam. You could do OCT scan, field test, everything you could do. Do not make an excuse because I'm telling you, when it is you cannot see, he who feels it knows it. Back to your question, sir.
All right, next question is, good morning, Dr. Batson. Should I drink baking soda in water first thing in the morning temporarily, or can I drink it on an extended basis?
The thing is, if you're using baking soda, which I do a few times, what you can do, let me see if I can put this. Okay, so half teaspoon and 8 ounces of water is your base. That is your least amount. Anything between quarter to half. If you are someone who suffers from hypertension, Let me see the fastest explanation I can give with this. Baking soda will minor in the beginning, and the reason for that is because of the chemical imbalance in the body and what the baking soda is actually trying to do. Remember, baking soda is what? Sodium bicarbonate. Structurally, baking soda has the ability to be a what? An alkalizer. Good? And we understand what alkalizing does to the body. Now, you keep in mind that the human body, one of the main aspects of how your body functions, it functions on acidity, alkalinity. So certain parts of your body must be alkaline, certain parts has to be acidic. So when people tell you need to alkaline your entire body, that essentially is not true, right? So that balance is going to take place, and that's one of the things that baking soda actually helps you to do. There was a study, I must actually get that study and name it and highlight it so people could go and check it, where some doctors in Italy, and listen to me, Italy has some boss doctors, Them fellas and them real bright over there. Very good at technology and that kind of thing. They are one of the best, they're one of the best doctors with robotics in the world right now. They, France, Germany, those countries. And what they did is that they did a clinical study with baking soda. And one of the things that they found is that baking soda has the ability to reduce inflammatory response in the body. So I would advise to you, if you're a hypertensive person, you use a half teaspoon, because the hypertension will get better, and half teaspoon would not be too much to cause a problem. Half teaspoon, 8 ounces of water, first thing in the morning, and you do that 3 days for the week. You could do Monday, Wednesday, Friday. You do that for 2 months, you stop for 2 months, then you go 2 months again. And you do it. You interchange. Because you see, things, your body, think of your body like this. It's like a building, a structure. So we have different things. We have glass, we have steel in the offices, you might have doors, you might have wooden surfaces, you have railings, whatever the case may be. All those different parts of that building require different solutions to maintain those different parts. You all understand, right? So the glass is a different thing. You have to maintain the glass, to maintain the metal, to maintain the floors, whatever the case may be. Your body is the same thing. So when you need to maintain your eyes, it have things for your eyes. It have things for your brain. It have things for your memory. It have things that you could use to improve circulation. It have things for prostate health. It have things for women who have issues with menopause. You have problems with sleep. There is something for everything, you know. But we live in a world now where the law is the law, and you have to understand what you say and how you say it. So legally in Trinidad and Tobago, one of the things that you should not do is make claims as regards to certain things. It regards to our law. Whereas in the United States, they don't consider certain things claims. So there's a whole, you got to understand where you're operating, primarily. But the main point I want you to get is that different things for different parts of the body. You want your hair grow, you have things for your hair, you want things for your skin, but there are basic fundamentals to things. Cleansing and detoxifying, 7-channel detox, Santulan, kidney, colon, bloodstream, liver, lymphatic system, skin, and your lung. Before that, your basic foundation rule is hydration. You must consume water. Water hydration controls everything in the human body, every single thing. Okay, so feel free to give us a call. Those of you who are interested in the Alkagen water, that premium alkaline water that we carry at Batson Associates, you can give us a call, as well as Santulan, that 7-channel detox. Remember, Christmas coming, so I can have a little Santulan. For Christmas, I just have a little pack done in the fridge, done draw steep there already. In fact, I did 2 in a 5-liter bottle. So I know if it is a parcel, a lime, I go somewhere, I am a thing. So you're making sure that at least you're cleansing during the season. And because if you use Santulan is a convenient cleanser. It's not no belly hot and thing. I mean, yes, you get a ball movement, but you know when to drink your Santulan. So you know it have a day a Saturday, say you have early Saturday morning, you drink your Santulan 4 o'clock. By the time 12 o'clock, your business done. You go to go back eating where you're eating. I ain't saying to overdo it, but at least now you're negating the negative effects of the little alcohol and the little black cake and the little, you know, because it's a one-sided thing. We respect that. But at the end of the day, you need to be responsible in what you're doing and understand to use discretion. Over to you, sir.
We have someone saying, good morning. I have internal tremors for a couple of years. What would you recommend for me? I'm 50 years old.
Okay, internal tremors. So the thing is, when you deal with tremors, as I said, you deal with central nervous system function. As regards to what we carry, what would help you with that, boy? Nerve restore would help. Definitely the silver or the mineral formula and the advanced chlorophyll. I would use those. Keep in mind the water, so make sure you're hydrating properly. Check your water. The rule, as usual, your body weight divided by 2 in ounces. Okay. Yeah, someone is just Jessica Class says, worse here, you must state that your product does not have the endorsement of the FDA. Yeah, but the thing is, supplements, and this is the next thing that a lot of people don't know. The Food and Drug Administration job is not to verify or to support what is said on supplements. But then you're looking at different law. Canadian law and US law is two completely different laws as regards to those things. But what you need to know is that, usually on those products, you'll see the Food and Drug, these statements have not been endorsed by the Food and Drug Administration. These products or this product is not intended to cure, and that's normal thing. That's disclaimer, that's legal, that's legalities. And that's something that we covered pretty well at Batson and Associates. I don't make joke with those things. So we ensure that, we dot our I's and cross our T's. But as regards to the individuals, as I said, when you're looking at that particular situation with tremors, especially persons where you're now getting it, because your central nervous system has a lot. That is usually the system that tends to be very problematic as you age. That's the system that we want to give you the most amount of problems. So obviously, that's the system that you want to work as diligently with to put how much, even with your diet. So we know nuts is very good for the brain. So we know cashew, almonds. You're looking at your natural oils, so things like your fish, so things like tuna, with those omegas in it, very important for proper brain function. Again, there's a product we carry at Batson Associates called Optimizer. Optimizer is actually has it's adaptogen, and it also has antioxidant properties. So what it actually does is helps to improve circulation in the brain, cerebral circulation, which is very important to prevent things like dementia and Alzheimer's, because that's how people end up with dementia, and Alzheimer's. It's when they do not have proper blood flow to the brain, and you actually have lack of blood circulation, which is very important for the transportation of oxygen and nutrients to your brain. Eyesight, people with the bad eyesight, all of a sudden you're getting blurred vision. You're starting to see rings or halos, or you go to the doctor and they tell you have things like macular degeneration, glaucoma. Early, that is signs of poor circulation to the brain. Okay, so feel free to give us a call. Let me just give you our office telephone numbers, and then we'll go back and take your questions. For the Shogunas office, you can give us a call on 222-8261. That's 222-8261. Debe is the corner of Ramsamut Trace and the SS Erin Main Road in Debe. That telephone number is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That telephone number is 220-8113. That's 220-8113. Tobago is the Triangle Building in Scarborough, Tobago. That number is 226-4553. I actually have to go to Tobago this week, so I will be in Tobago this week. So that's something we work on. Also, someone is asking, do you have gift certificates? Yes, we actually would have our gift certificates. They should be ready by this week. So we would, that is something that we're doing. So you can actually give a gift of good health to somebody. Think about it. I will consider you a great friend of mine. If you can imagine your friend give you a gift certificate to come back to an associate, but I love that friend. That's a real good friend. You get through it. As a friend to have. Friend to have. You understand? So let's go to the questions.
Someone is saying, blessed morning, hi doc, having a pulling finger sometimes in my index finger. Can you tell me what can be the reason, please? It's like a shocking sensation, like especially when I use it, unexpected. And can anyone use probiotics if having stomach problems?
Okay, so first of all, the first question is a pull finger. Well, if I tell you, I remember something. When she say pull finger, I go to say jumbie, you know. I go to say jumbie girl, or boy. Is a male or a female?
I think it's a female.
It's a female. It's a girl jumbie. And the reason why I say that, no, that's laugh. Your former work colleague who was here, there was a time I was doing a program with him. That's Mr. Green now.
Yes.
And we were talking about spiritual experiences.
You know
about them things. And so I told What? Let me be myself. I was I laughed most atrocious on that program because Dion said, he said that happened to me already, but this thing, and I feel this thing. But here Dion said, it started pulling finger. So I said, but what kind of thing is that? I said, but that's a special job. Really, when I had my experience, which I know it was something, they didn't pull my. I said, what kind of?
It used to be your toes there.
Yeah, well, I said, well, what kind of, So I get frightened. I say, Gil Jumbie, we live in. But with that's all the story. That's just me being troublesome. But the thing is, usually when you're getting that sort of sensation, and let me explain something to you. Anything that feels tingly, anything that feels pulley, chucky. I using colloquial terms here. So anything feeling chucky, you're feeling junjuni, as they say, but I know everything have an E at the end of it, but or I. Yeah, whenever that central nervous system, guaranteed without a shadow, you feel like things walking on you, like ants, central nervous system. So it means you need things like nerve restore, optimizer, magnesium, but there is a but with magnesium, people. Not all magnesium, in fact, not all supplements are able to be absorbed properly. That's the next thing you all have to know. Because you have many different forms of magnesium. You have magnesium aspartate, you have magnesium citrate, you have magnesium chloride. There's one that I use, Chloro. That I like. I like liquid magnesium because I always find it works better in terms of intracellular, extracellular fluid. So it really does help with the electrolyte balance. There's one that we usually carry. We have in stock actually. So that's something you could always look out for. You're looking at things like your omegas too. I'm big on that. Big, huge. Because I think people don't really understand how important that is. There's a particular product that is quite famous and people talk about it a lot and people try to downplay them. I am not necessarily endorsing the product per se, but what I can say and tell people, do not underestimate what they are saying about that product. Don't. Because if you understand nutrition and understand what it is that happens to persons, there's a reason why we have a significant cognitive decline in the world all over. Why I think we have so much people with cardiovascular problems? It's all that sort of vegetable oil they give people to use and tell you about heart. That have nothing to do with your heart. The worst thing you could use is vegetable oil because the heating point of that is a different heating point. And when you heat that, you change it. It is not beneficial. That's like cooking with olive oil. All oils have heating points. It means
so many people use olive oil. Cook. So many people now use olive oil to cook.
No, you're not supposed to cook with olive oil. You're not supposed to. Do not do that. You're going to end up yourself with plenty problems with that. When I tell you plenty problems, you will cry. Don't do that. Right, so it's just a matter of understanding, but those omega, and the thing is, if you understand where omega primarily comes from, there's one that we have that actually has astaxanthin in it, and that particular compound, astaxanthin, is an antioxidant. So you have an omega that actually has an antioxidant to this. It's like a double-edged sword. So what that actually helps to do is help with central nervous system. You see pain? Man, that's a masterful product for pain. All you have to do is ask for the omega with the astaxanthin. Or if you can't remember the big word, tell them the omega with the A word. Right? The omega with the astaxanthin. Right. And let them that is going to give you some very good results as regards to pain. That's one of the things we're going to be pushing forward a lot with next year, please God, that and diabetes, because I'm still not satisfied with these diabetic numbers that we have in Trinidad and Tobago. It's like everybody have diabetes now, and we need to really do something to help that situation. So again, those telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. We also on the corner of Ramsamouch Trace and the SS Erin Main Road in Davie. That is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number is 220-8113. That's 220-8113. And Tobago is the Triangle Building in Scarborough, Tobago. That number is 226-4553. Tobago, we are on the finishing line. Well, not finish line. We're on the finishing stretch to your office. If you want to see your office, it's looking nice for detox. Or you're getting colon hydrotherapy, or you're getting the works, massage, everything. Over to you, sir.
even as you said that, I have a kind of comment of my own. As you're talking about diabetes there, I remember speaking to my doctor a couple months ago, and she was saying that there has been a study and trends now where persons have been developing diabetes a year after having COVID.
Okay, right.
Yeah.
The thing is, people fail to understand really. Please explain why one shouldn't cook with olive oil. Okay, no problem. I'll do that. That's Miss Nicola Hood. Keep in mind, again, our Facebook, Miss Perlin Henry Rajpaul. Good morning to you, Miss Angela Andrews, Jessica Clark, Ricardo Belcon. First time listening, very interesting. Nice having you, sir. Jessica Clark mentioned chelated magnesium. Yes, good. There's actually a product that we used to bring in before. We used to get that. And we're actually going to start back to get it next year. Please God. Real good vitamins, boy. Top of the line. Nicole Hurd says, please explain why one should not cook with olive oil. Good. So I'll do that just now. What was the point I was making? I lost my train of thought. Oh, yes. Good. With the study, right, where they were saying that people with diabetes after COVID, right. Now, the thing is, COVID-19, like most viruses and most pathogens, this is the next thing that some people just do not get. And I hope this morning you get it. When you get an infection, whether it be the cold, whether it be shingles, whether it be COVID-19, whether it be SARS, MERS, pathogens are very, 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 very smart. Right? What does that mean? It means they have the ability to change. There's something known as pleomorphism, which means they change structure, they change appearance. So they are not easily recognizable recognized by the immune system. So with COVID-19, what a lot of people didn't understand is that you could get the COVID infection and the COVID virus could remain dormant in your body for extended periods of time. You remember there was something called chikungunya? Right. Now, chikungunya, I used to call that the crippling virus. When I get chikungunya, I know people who literally was walking on their knees, all fours. Yeah. They couldn't move. Yeah. You know why? All pathogens, especially. So people think that COVID-19 just affects your lungs. No. COVID-19 affects every aspect of the human body. It will affect your musculoskeletal system, your central nervous system, your endocrine system. Why do you think we're having so much people with cardiovascular problem now? Yeah, cardiomyopathy and that thing. So it is no surprise to me now that they're finding people who had gotten COVID before, and God knows if you don't know how to take care of yourself, well, God help you out here. Yeah. They're going to end up with all sorts of different things because of that. So you have to understand that viruses, pathogens stay in the body. That is why long COVID. People don't understand this thing what they call it long COVID. I remember there was somebody who because I always try to do what I do to the best of my ability and do it properly. So I remember there's quickly somebody recommended somebody to me and they recommended someone. Now, if you get my personal number, consider yourself lucky. I don't give up my number, so obviously, right? But there are people who have my number because when I started business, I used to use my number. I used to do everything, delivery, everything, right? Now, the thing is, what it is to realize, so somebody called me and say, oh, this person have COVID and whatever. And I take my good patient time. I had a client, excuse myself, went and take the call, take 20 minutes on the phone and spoke to those people and tell them, I say, okay, so let your spouse know that this is what they have to get and whatever the case may be. It was a favor to somebody, yeah? So I long explanation, I tell the person, I said, this is why he has to take this. This is why they have to take this. This is why they have to take this. This is going to do this. I give you a whole lecture. To these people and them to waste my good time, to call my office afterwards, to tell my office that them call the doctor after, which I have no problem with your doctor. And the doctor said, no, don't take all of that. That ain't making sense. Just go and take a vitamin D3. I said, okay, good, no problem. And the people had the audacity to tell me that. Well, they tell my office that because I make preparation because the emergency, the thing, call, wherever the case may be. There's a reason why I'm telling all of this situation. So the same thing and the receptionist in the office say, Dr. Batson, after we went through all of that people, they say, they call the doctor and the doctor say to just take vitamin C and D3. I said, okay, good, no problem. person is highly annoyed. I said, no, well, they don't vex for that. Remember, it's a service. We're doing a thing, whatever the case. I said, no, leave that so now. So, about a month after, I'm going to get a phone call on my personal phone, like apparently I work in Victoria, to call me, to tell me, you remember? So. And I really did remember. I said, yeah. I said, but you see the time? It's 8 o'clock in the night. You know, you really ain't supposed to be calling my phone now. You know, and I don't really do that, but I was tired that day. I was taking my rest. You know, and they say, well, you know the situation. I say, listen. I say, it's an emergency. You think they were dead? No. I say, well, here what? You're going to call my office Monday, and you all will come and take your appointment then. Don't waste my time. As a big man. I say, I know why I told you what I told you, and you did not listen. You so flippantly called my office and told my office after we spent all that time with you that your doctor said to take vitamin C and D3. So I suggest you take him and carry him Friday. Go, where you get that advice. Because if he had listened to what it is I told you, he would not have ended up in that situation. You know, the man ended up in the hospital. And you know why? I told them, I said, buy the silver with the mineral formula. Get a vitamin. I give them everything, you know, about 6 things to take. So I'm not saying this, and this is why you see when you like to concourse, sometimes you end up spending more money. Because and I explained to the person why I told them this. Because let me explain why I told them what I told them. This person who this was for had gotten COVID not once, not twice, but 3 times. And you want to tell me you get COVID 3 times, and you listen to a foolish doctor who tell you to take D3 and vitamin C alone? Are you mad? They're lucky they didn't die. They're lucky they didn't die. But the reason I'm telling you that is because I told them, I said, listen to me, COVID does not go. Don't all watch me. Don't play with that. This is a serious, serious thing, you know. COVID will stay in your body for years. You know what is dormancy? When I see this dormant, is it dead?
No.
All right. It's not dead, right? So once the seed gets the correct environment that is conducive to its normal function, which is to grow, the seed is going to do what? Propagate, grow. So you'll end up with a tree eventually, right? Bacteria, pathogens do the same thing. And that is why we have reached a stage in this world, in medicine, where we have so many bacteria, antibiotic-resistant bacteria. Because of that same thing. Years ago, I remember, I'm not that old, we used to get what for the cold? I don't want to call the people product name. It had things they used to give you for the cold when you get the cold. Now, anytime you get the cold, what do you get? Antibiotics. You know why? Because that common cold, that them thing used to kill, not kill it again, the cold ain't common enough. The cold they have now is ravenous. You realize you're getting some cold and you feel like it's COVID yet. You're sick of joint pain, back pain, waist pain. No, listen to me. These pathogens and them moving different now. Them fellas and them dread. It's like somebody put on a robbery in an area and they tell them looking for a Tida and them poor, oh God, no, sorry, I shouldn't stereotype the people vehicle. My apologies. They're looking, my apologies. I did not mean to do that. That was just the closest name could have come to me. But it's a vehicle. So you're driving vehicle A and they're looking for your vehicle A. But you ain't realize them fellas done halfway down the alphabet, them in a K. And you looking for them. You think you could find them? That is how pathogens behave. The first antibiotic they give you, when you go inside of there and you go and start to make a sort of noise and make melee, and then them fellas say, oh, all right, they send one for we here. You might weaken them a little bit, they get a little gun, ting, ting, ting. Them fellas and them come out and they come up stronger the next time. And then they get stronger and stronger and stronger and stronger and stronger. And it now becomes resistant. So what you're going to do? Take all the antibiotics they make? No. And that is why I told them what I told them. And so said that I come back afterwards. You know when I finished with him? You know what he said? He said, Dr. Batson, I waste time. I said, well, I'm glad you know that. And money, but such is life. It's your time and it was your money. He said, well, I understand what it is you're telling me. Because he also had a lung problem. So I couldn't deal with you. Were you telling me foolishness about vitamin C and D3? These doctors and them only know now about D3 since COVID, you know. Check it. Prior to 2017, 2018, you wasn't hearing nobody talking about vitamin D3. All of a sudden, D3 is one of the biggest thing now. Why?
Far more even K2.
Well, let's talk about that. And that's basic. That's basic. I use K2. I always tell people I use K2. Must be about what? Must be about 12 years ago. Through Coida and them. They say it's long. That's basic. When you do now, the bachelor's I do, that was basic nutrition first. So you have to understand, and that's why I was saying at the genesis of the conversation, when you really understand what nutrition is and what certain things could do to the body, listen to me. God in his wisdom know exactly what he's doing. Yes, so as regards to the olive oil situation, let me explain to you why you do not cook with olive oil. All oils have heating points. You could go and read this. The reason why coconut oil is one of the best oils, regardless of what anybody says, is that coconut oil does not have a long chain. Coconut oil has a medium chain. So it is referred to as a medium chain fatty acid, right? So because of that, it could heat, and the heating point is very, very high. And the oil does not become denatured. What does denatured mean? Denatured means the chemical structure of the oil is intact. When oils become denatured, the chemical structure changes, and it also leads to a more cancer-causing situation, because you could end up adding hydrocarbons to the situation because of heating. Remember, heat changes things, temperature affects things. So that is why you should not cook with olive oil. Olive oil is to be drunk, room temperature, and it is to be drizzled on your salads. If, like me, if I do fish, like maybe, salmon or some fish. I love fish. I turn it twice. I would use it like grapeseed or something, turn it twice. And when I finish and I put it in the plate, then I will throw the olive oil on it. So like that you could do, but you're not supposed to cook with olive oil. You're not supposed to. That's not. That's like barbecue. You know why you're not supposed to barbecue food, right? The reason why you do not barbecue food is that it becomes, because of the coals, you end up adding hydrocarbons. So you change the chemical structure, and the meat that you barbecue is no longer good for you. It is now carcinogenic. So be very careful with barbecue. The little, and I know people just do the little barbecue once in a while, but be very careful with that. Grill is better because grill is a heated surface. Yeah. Right? As opposed to No, you're going to have to do some research. Let me say this quickly, especially you all who like to cook on grill and those type of surfaces. There are different types of wood that they have. Like I know in Tobago, there's a mango wood that they have that they normally smoke fish with. That is a different thing. But you're going to have to do your research, because things like smoke, especially coming up in the season, because ham and nugget, and that's how hams are prepared, right? So hams are prepared they use something smoked, so they have chemical smokes that they could use where they rub it in and that kind of thing. Yeah. And I mean, the time of the year, if it is end of the year, you want to eat your little ham, me go kill you. I tell people, but discretion is where it comes, and that's something you don't want to consume too much. You don't want to consume too much of those things. Cause increased cholesterol. It causes a lot of problems in the body. So you don't want to, partake in those things too much. In between, and you're good to go.
As you're on the issue of oils, someone is asking, well, they said they used to cook with, they have been cooking with olive oil for a long time, for months. But they stopped. But what healthy cooking oils, what alternatives can they use instead of that, apart from coconut? Yeah, coconut. Apart from coconut, you have grapeseed, you have avocado now. Just know your brands. Brands are very important now in the world. That's why I hear people, I tell people I am very brand specific. I use grapeseed oil. I've been using that for a while, even before they were actually bringing it here, because I used to get from, I had a friend who used to bring it in, in fact, rather. So you have that, you have the avocado oil and the coconut oil. I mean, you have like about 3 options there. Be very careful with mixed oils. I don't believe in that too much, because you can't mix coconut oil with olive oil, really. Nope. What are we gonna do that? The only thing you can do that is drink it. Based on the conversation we just had, you can't eat it. Yeah. So you need to be very careful. There was actually a study that they did. There was a doctor who did a study. Where she from, boy? She is in somewhere, either Japan or Singapore or something like that. And no, it was the University of China. And they did some studies, and there were a lot of oils that they had that, they were putting that on the bottle, but that was really what it was. So you need to be careful. Yes. We live in a world now where we just need to be careful. It's amazing how people are so dishonest about things like that. I mean, this thing for people to ingest, oh God, man. You give people thing and tell them it's that and it's not that. Come on, man. But it is what it is. So you just need to dot your I's and cross your T's, right? So someone is saying, hi, good morning to you and Dr. Batson. I would like to know if ashwagandha is good for pain.
Ashwagandha is good, but ashwagandha's strong point is not pain. There's a product we carry at Batson Associates called Nerve Restore. Ashwagandha is actually one of the ingredients in that. That's a product I love. I love it. Again, efficacy and potency is very important. Brand is very important. Because I actually did a small experiment with that Nerve Restore. There was this particular product that I bought that was supposed to have ashwagandha inside of it. And I gave it to about 100 people who came to me. On average, I noted it. I have everything notarized there. And but I did it to see, because I know what this ingredient is supposed to be able to do for me.
Yeah.
Because I did ask Ayurvedic medicine, believe in it, very, very good foundation of medicine. And the whole long and short of the story is that the clients got results, but maybe it was it wasn't to the standard that I wanted. And then we got Nerve Restore, and I got exactly what it is I wanted. Yeah. So when you're looking at pain, ashwagandha is good, but its strong point is not pain. When you're looking at pain, you want things that primarily operate, even though ashwagandha would have some aspect of reducing inflammation in the body, but you're looking strong point for things that are going to primarily deal with pain receptors, in some cases cross the blood-brain barrier. So that's where you have things like inflammation formula. Optimizer is also very good. That omega with the astaxanthin, very, very, very good for pain. Exceptionally good. So those are some of the things that you could look for. I'm not saying that you cannot use the ashwagandha, but in terms of using it for what you want, based on the conversation that we have, because remember I tell you, you have things for your eyes, things for your head, things for your hair, right?
All right, we have a voice note here.
Hi, good morning to Lyndon and his wife, and Dr. Batson. Dr. Batson, I sent a gentleman to you concerning his eyes, and he got the result. He's much better, and everything is okay. Thank you very much. But no one did a follow-up him.
Oh.
I am getting a sharp choking pain in my back and the spinal area. Sometimes it just took me and I get weak, feel like I want to fall down. Or can you tell me what can be causing that and what I can do?
All right. Okay. So first of all, thank you very much. I'm glad to hear that you sent someone and they got good results. I'm concerned about the last part. You said nobody didn't follow up with them. So if you could kindly send that person's name, I might need to have a discussion. Some people get, but you know, we don't make a joke with that follow-up thing. That's a very, very important thing. So I do apologize for that, and we will work on it. As regards to a question about the choking in your back, the thing is, okay, so let's break down musculoskeletal. So, okay, our next thing for all, I'll tell you, give away again nice free information. CMOS is all your friend. Only get an ex-doctor like this, wait, when you see they start, anyway, let me just say that, but I'm not going to say just now they want to give me pay-per-view, Only careful, Only getting it free now, so take it, just now, they might have to pay for it, careful, just saying, man, you ain't going your big set of money, but anyway, so, CMOS, musculoskeletal, anything, CMOS.
Yeah.
Now, I'm not going to say that's going to fix everything, but it is going to help. So when you're looking at choking pain in your back, especially your spinal column, any problem with your lumbar and cervical vertebrae, you have an acid problem. Your problem is acid. Anytime you have problems with your back, bad musculoskeletal problems, acid. End of story. Acid in places that it is not supposed to be. How do we get that out? Now, that requires some work. I told them next year I'm going to advertise myself as a rheumatologist. Honestly, God hear me. You're going to see Dr. Batson Sogre, certified rheumatologist, integrated rheumatologist, because I help too much people with arthritis. So the point I'm making is that musculoskeletal situation, that is acid. So how do we fix acid in the body? Now, acid could be a little complicated, especially if you have what is known as lactic acidosis, which plenty of people walking around with and they do not have. There is something known as gout, which is excess uric acid, and the uric acid usually settles or concentrates itself in the joints. So someone who has a high amount of gout or uric acid is going to get problems primarily in their ankles. You're going to get it in your knees. You're going to get it in your joints primarily, elbows, that kind of thing. Excuse me. So with back problems, you need to address the acid problem. So how are we going to address the acid? First thing, water. If you could get the alkaline water, no problem. I'm telling you, you would not be disappointed. That's one. The next thing is your diet. So you remove foods that cause acid ash in the body. So acid ash as ASH. So this is how your body operates. When you ingest certain things or certain things enter the body, even from the point of touching saliva, it has a response or an effect on the body. It is going to have either an acid effect or it is have what we call an alkaline effect. And those things are what we call the production of acid ash and alkaline ash. Good. Foods that produce acid ash would be the first culprit of them all, SUGAR, the sweetness. So all the sweet people in the room, show your hand. The sugar people, that's one.
Yes.
Dairy, milk, cheese, butter, acidifying foods, right? When you're talking about your meats, you know the one all like the best with the snout. He's the head. He's the head of the circus, Mr. Pig. All the pig lovers, right? If it is you like pig, do cleanses often. Simple. You know you smoke cigarettes, use olive oil every day. Go and buy a bottle of olive oil. I already tell already one to use. Drink a tablespoon of olive oil every day. You can't be smoking cigarette. Now, I am not judging anybody. Yeah? I am not. They say I am sinner like everybody else. I'm not judging nobody. God is the judge. But I am saying to you, and if you start to smoke, let's be practical. Smoking is one of the hardest habits to drop. Why? It is highly addictive. So we know that.
Yeah.
So all these lovely ladies who love your husband and you're making noise, stop smoking, stop smoking, stop smoking. It is not an easy thing to do. So if you want to go on that journey with people, you have to go. That is a journey that requires a lot of discipline. It's going to require a number of things. And, that is going to make, your situation worse. So what you need to do is do things to do what? Negate the negative effect of. What does it mean? Negate. To reduce, to lessen the impact of. Right? So common sense maybe for book. You don't expect to smoke cigarette for 30 years and then you get a diagnosis of lung cancer and you're looking up in the air and saying, God, why? Really? God should give you a response. God, why what? You put yourself in that. So big people business, big man thing. You're smoking cigarette, drink your olive oil every day. For me, make sure and drink your water, please. Trinidad and Tobago.
What about someone who is who smokes like quite a bit?
Right.
Not the normal one, like packs a day.
Like packs a day, yeah. Yeah, they need to, and that's what I'm saying. You have to you see, the thing is,
one tablespoon will work for someone like that, especially now where they have a kind of incessant cough.
They might not call Batson Associates. I would have do that because I'm telling you, you're lining up for some lung cancer, and lung cancer is a cancer you don't want. After pancreatic cancer, the next hardest cancer to deal with is lung cancer. Lung cancer is a funny, regardless of, and not necessarily the type of cancer, but the locality and the importance of the organ. Remember, your lungs is the lungs is 1 year after your colon is your lungs, actually thinking about it, and because I normally used to say central nervous system, but thinking about it is your lungs, because if you can't breathe, that's it, you're dead.
Yeah, that's it.
Yeah. So, and even the people who, and this is something again that people don't want to hear, but let me not stray. Let me finish this part. So, a person like that, I would drink the 1 tablespoon would be good. It would be good. But people don't understand what olive oil does, and healthy oils on the whole. They coat the lining of your esophagus. They're very good for your kidneys. They're also very good. Remember, oil is what? Lubrication, or no? That's why omega is so important in the human diet. Most people who take omegas don't take enough. You come by Batson and I have to give you omega, especially if it is, you have to use, there's one we have called advanced omega. It's because you have to take 4,000 milligrams a day. I take nothing less than 4,000 milligrams of omega every day. Right now, I'm so upset. Out of my personal set, I haven't taken for like about a week. And you feel the difference, eh? Now, the difference is not a major difference, but let's say I stop taking it for a year. Obviously, I'm going to see. Yeah. And that's because remember, I am working every day, I'm doing programs. You have to understand your body, like everything else, your body works. You think you working, you do nothing. Is your body doing everything?
Even when you're asleep, your body's working.
Your body is working. And that's why a lot of people don't understand. You were blessed with one of the best pieces of machinery, which mankind can make. They can't duplicate nothing we have. Don't let nobody fool you, They can't they ain't even close, to tell you the truth. Because the hands that they give you, ever see somebody with these robotics and that kind of thing? What your hand is able to do, your digits is able to do, no robot in the world could do. You don't let a mama guy and tell you that they're doing that. Listen to me, they just don't know the full capacity of the human body because they didn't study it properly.
Yeah.
They didn't test us against certain things. There are certain limits to the human body. I'm not saying no. But when you look at how everything is orchestrated and well put together, it's just a matter of dotting your I's and crossing your T's. So as regards to the cleansing and detoxifying aspect, people who have problems with people who do certain works, like, you're a hairdresser, you do certain things, you need to pay very close attention to those things.
With the chemicals that they use.
The chemicals that you inhale. You can't be a hairdresser and not doing cleanse and detoxifying. You're going to die. I am telling you, you are going to die, and your death, God forbid, is not going to be a nice one. You do this research and check. The thing is, we don't keep proper records here. Or let me just say that our records could be better, like with everything else. You could always better your best. But the thing with a lot of individuals is that if it is you look at within the past 10, 15 years, you realize a lot of hairdressers are dying from cancer. A lot of men who do, check, I can tell you, because I see the numbers. The majority of men that I deal in right now with who have problems with prostate is men who are either mechanics or they worked in agriculture. I don't know why people listen to me. When you're working with agriculture, when you spray anything like Gramaxone and Paraquat, you have to clean that out of your system. You're supposed to be drinking your oil before you go in the garden. You get your olive oil, you drink 2 tablespoons of olive oil. You go and spray. Do we have to do? Wait, shall I wear a mask? Somewhere down the line, you have a cleanse to use. Use your cleanse, clean out your liver, clean out your... Because that is what happens to you, is build up toxins in the body, what causing all these problems that everybody having. You know how many persons, and this is not to become litigious here in any way or controversial, you know how many persons professionally from their job died, and it was because of the job that they do? Yeah, big. That's that. That's why I say that how I say it, because I could open my can of worms. Yeah, that's a serious thing. Because health and safety is now becoming a big thing in Trinidad. We still way back with health and safety. I still see people on scaffolding like mad people. You no harness nothing on you. So when you look at that, a lot of people, look at people who work in the oil belt. Go and ask, go and find out where they are. Now, that could turn into a whole legal problem there. But at the end of the day, I'm saying to you, and a lot of the times when you take these jobs, you sign paper. Because a lot of times the remuneration package is designed in such a way to factor those things in. Poor you don't know that they're supposed to have a cleanse regime for all here. But there is nothing called Batson and Associates, and we will do it for you. There was a young lady who came to me some time ago, sick like a dog. When I tell you sick, how can I say she coughing, this, eye running, nose? If you see she in a condition. I said, what's going on with you, young lady? She said, well, my mother sent me like, they say you're good, whatever the case may be. I have a problem, and the problem can solve some breathing and some skin thing. I said, let me ask you something, where you working? So she works in a facility that does certain things. Okay, I say, good. All right, now. Boom, boom, boom. I said, but you are no asthma. You are occupational asthma. The girl look at me. She eye open, big. She said, wait. So you're trying to tell me this happening because of where I'm working? I say, yes. However, common sense may be for a book. I can't go and write no letter and tell your boss and them. But I am telling you, based on my experience and what it is you're doing, that is the problem. She said, you sure? I say, yeah. I said, well, we could put it to the test, you know. Say, how are we going to put it to the test? I say, have any vacation you want to take? She said, well, I have some time, and whatever the case may be, I will organize and I'll take some time. And they did take time. And they stayed away from work for 2 months. And I gave them cleanse, I gave them different things. All the problems went. So I say, it's an experiment. She said, but oh God, how good I feel. And I think next thing I go back and it's really that. I said, I'm telling you, it is that. It is going to come back. She She said, all right, no problem. Well, I say, you have to go back to work. She said, going back to work. I told them, use certain things to maintain so that you don't have the problems. And they did. The thing is, when they did not maintain, these problems started to come back slightly. Bing, 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 bing. I know maths and physics and that. So a lot of times, the work that you do, if you don't do what you need to do in terms of cleanse and detoxifying, I am telling you, you are going to end up very sick. Let me touch on this note quick. How we time going here? You know, I talking and we're going on.
Yeah, we have some time.
All right, now, people who are cleaners. So we're not talking about regular ladies who, you know, doing the little normal housework and talking. We're talking about your work as a cleaner. Nothing wrong with that. You have to take care of yourself. You're doing honest living. People who work in CPEP and all these places and them. Let me give all you a word of advice. Santulan is not $1 million. Even if it is, you cannot get the Santulan, get a little box of baking soda and put a little half teaspoon of baking soda and cleanse yourself. Because listen to me, if you're cleaning a drain, you ever clean the drain in front of your house? Imagine cleaning a drain somewhere else, especially now with all this water and all kind of thing. People don't understand how pathogens operate. You could just move water in a drain and that will send up pathogens into your nostril. That's like your washroom. Like, you know, when you use the toilet home, when you flush in the toilet, you're not supposed to flush the toilet with the lid up, right? I think everybody know that by now, right? Because if you flush with the lid up, all that set up germs and bacteria actually comes up in the air, and that could go up in your face or go on your skin and that type of thing. You're not supposed to flush a toilet sitting down on it either, especially women. Don't do that. Don't do that. There are some women, you sit down, you urinate, and before you finish, you flush. No. You're going to get either a UTI, could get a bad urinary tract infection. So I was just using that analogy to tell people who even work in certain industries where you handle certain chemicals, like people who deal with chlorine and ammonia and those type of things. If you work in jewelry and people who work in jewelry handle very, very caustic and corrosive chemicals. If you work if you're working in this thing too, welding, these men, I don't know what all of them, but people who own mechanical, they're hardened, boy, oh God. You dealing with diesel and oil and gas, vehicle tumbling and all inside of that yard. Wait till all smelling.
Carbon monoxide.
And then people just wonder why they get cancer and why they get things. Because you're not paying attention to yourself. Now, I mean, the thing is, you don't really hear doctors telling you what it is I'm telling you. But I'm telling you. Because the thing is, common sense make before book. I always believe, at the end of the day, an ounce of prevention better than a pound of cure. I want no problem. I tell my parents the same thing. I have my mother on a strict the other day. She said, oh, you getting big so, lady. What's going on with you? Come, we need to trim. I tell my father, I said, what's going on with you? She getting big so. Going on with all you. Because I don't want no problems. Because I's the one who would that. No. I ain't saying old age is old age. But a lot of people, you could reach your ripe old age, and when the good Lord ready to take you in your sleep or something. Easy that. See the suffering with stroke and thing and in the hospital and all the grandchildren money finish, the children money finish because they're spending money behind you. No. That will make no sense. Make no sense at all. Look out for our pensioner special, which we actually going to be carrying into next year. I could say it. We're going to carry that package into that special into next year. We also have our Christmas special, and we also have gift certificates available as well. Those gift certificates, I know we should have all those. Well, the thing is, once you call, they will make the necessary recommendations and what it is you need to do. Let me say a pleasant good morning again to our Facebook listeners. Ms. Roxanne Herbert says good morning. Ms. Jessica Clark is in the house. Ms. Joyce Hamilton. She says, morning, doctor. Whoa, first time hearing about you. Very interesting topic. I learned a lot. You can tell me which is the good olive oil to use. Thanks. Yeah, I'm going to put it up. Is one called James or somebody. That's the one that my great-grandmother never used to use that, and that's the one I stick using. I found it. I remember I went somewhere, and they had it, and I buy about 10 bottles. If people look at me like, what's going on with you? I was like, I wasn't seeing that way. Come, give me all. All. Everyone I take. So I wouldn't run out for a little while. So that is one of the things that you need to pay attention to. Keep in mind our overseas consultation for your online overseas consultation as well as product services. That telephone number would be 1-868 Trinidad area code 868-373-2388. That's 868-373-2388. Also look forward to those the kidney clinic that we'll be doing in God's will next year. That clinic would primarily be to help persons who have, they tell you your kidney in good, you're showing high signs of creatinine, high bond, your GFR is very low, maybe stage 5, stage 4. That program is going to be primarily geared to persons like that. So, if you have no persons who have real bad high blood pressure, this blood pressure not going down, because as I told you all, if you have a high blood pressure situation, Trinidad and Tobago, please pay attention to your kidneys. I am telling you, dialysis is not vacation. You are not going Barbados. You are not going Bahamas. You ain't going Atlantis. You're not going to lie down on the beach. You are going to be, no. And I'm not saying this to make people who doing this feel bad. We can't turn back the hands at time. However, people know who know. So please, Trinidad and Tobago, listeners of Sky 99.5, if you know you have a blood pressure problem, we getting teased back just now. As I say, we just had a little situation that we needed to fix. We fixed the situation. So God's willing, by the end of next week, we'll have those teas. Get your little high blood pressure tea and your circulation tea. Watch your water you're drinking. Because listen to me, especially men, because men have a mentality that they feel they're larger than life. You're not. You're not. If you look at those dialysis clinics, men way outnumber women. Way outnumber. I think it's maybe about 80-20, maybe 70-30. And that is because men usually are what? Hardened, or they don't listen. So all the lovely ladies, the lovely wives and mothers and daughters and aunts who have men in their life that they're concerned of and you're fed up, talk to them. Just tell them to listen to us and hopefully they will get a little kind of incentive. Men as well, please, your prostate is your good friend after your other friend. Please take care of him. If you do not take care of him, he will not take care of you.
That's right.
And they have a way now you're losing them, I remember as a child, we used to play marble, we used to play pitch. We used to play 3-hole for bogey, and we used to play rings, right? Nobody don't play marble again. I can't remember last time I see people play marble.
I haven't seen it in a while.
And I, as a man, used to make sure and keep, watch me, if you want war for marble, I and my brothers have watched my war, you can't interfere with my marble, because when we play, somebody have a win, and you notice something called a bigoons. Yes, you cannot interfere with my bigoons marble, you're a madman. Watch man, long time them marble prettier.
Yes.
Right. So, gentlemen, the reason why I'm saying that the 2 big ones God gave all you, take care of them for me, please. Don't let nobody come and take all your marble, because watch me, they're taking marbles now. Now, plenty people walking around and they do all the marble. And let me tell you something. In order for the fella in front to work properly, the marbles must be present. Don't let nobody tell you no nonsense, but they're taking out your prostate and you can function as a man. Your wife is you're going to have some problems. You will start getting cold food. And a cold shoulder. And cold food don't taste good. You can't give me cold food to eat. So men, I want all it to be having some nice hot food. These ladies, once you know what they say, once your wife happy, whole house happy.
It's true.
It's nice food you're getting. Yeah, your wife agreeing with that, right?
Yes,
right.
She's agreeing.
So marbles, fellas, I had to do a program like that. Only one trouble again, only real trouble next year. Next year I'm going to do a program. Please do not lose your marbles. Them bigoons that God gave you, guard your bigoons and them fellas. Guard your bigoons. Right. Take a little cleanse, take a little detox. If you know you're a meat mouth, all the meat mouths with the big bellies, 2023 coming up. I don't believe in resolutions, but I believe in goals. In management, they tell you goals must be SMART, acronym, specific, measurable, attainable, realistic. Last one is what? Targeted. So set your goals. You want to take down the little belly? Because I telling you, all the talk, big people is talk and respectful. You don't function properly when that belly big. We want them woman want some abs. Flatten down that stomach. Proper business.
That's right.
Right? So, with that being said, I give it all the thing. I'm trying not to be delinquent there, but I know the weather calls for the conversation, so I'm making sure and take care of the people.
Yes.
So give Batson and Associates a call, sir. Let me take your questions and see before
All
you're
right.
ready to finish
So
this program.
those of us who would like to call in and get your questions in, feel free to call. The number is 624-7729 or 625-2759. We have someone saying, good morning, Lyndon and Dr. Batson. I'm a diabetic and I was diagnosed with retinopathy, and that which has caused extremely blurred vision. Is there anything you can recommend that I could use to help correct it besides surgery? Also, please send me Pinal's WhatsApp number.
Okay, so first thing, Pinal's number, I'm going to send you Pinal's number, which is 223-7515. You could also take, so DB is 223-7515, but I'm not too sure if that is the WhatsApp number. It's a lot of phones we have. What I could tell you, 314-9975. That's 314-9975. That's head office WhatsApp. So you could always send it to that. As regards to the diagnosis, my apologies, of diabetic retinopathy, yes, we can help you with that situation. Please, though, well, I don't know if you did surgery. I don't think you said anything about surgery. You said you went to the doctor and the doctor told you that you have that. But that is a situation where you're not getting sufficient blood circulation to the brain. And as a result of that, you find that it is contributing to problems with your eyes. So we could fix that situation. The eye optics formula is definitely going to give you some help. Optimizer is going to give you some help. There's a stem cell supplement that we normally use too. Very good. I'm a big advocate of stem cells. Huge, because they work and they help in repairing and rejuvenating the body. Okay? Facebook gone clear with this marbles talk, boy. You see all they like trouble? Facebook in an uproar here, you know.
I can imagine. Someone is asking, how can you get rid of knee spurs?
Knee spurs. Okay, so spurs is an indication of high acidity in the body, and because of the high acidity, your body is now compensating by pulling calcium from the bones. It will pull from the weakest bone. So apparently your knees may be the weakest. I don't know your weight. I don't know if you have some weight. Possibility exists. You may need to have to lose some pounds to help take off some stress off of the knees. The Alcogen water would help. The inflammation formula, the omega with the astaxanthin, as well as the joint tea. So those I would suggest. Keep in mind to understand that the rule for drinking water, right? Your body weight divided by 2 in ounces. And as I said, I believe you may have to lose a little weight in order to take off some of the tension and stress from the knees so that they can start to work. Of course, CMOS, you could get that. And we do have that available at Batson & Associates, some real good proper CMOS. Let me say a pleasant good morning to Ms. Jennifer Valentine. Pleasant good morning to you. That is a client of ours out of Texas there. She has gotten some very good results. She has sent so many people to us, and they too has also gotten some good results as well. Yes, sir.
All right. We have a call on the line. Caller, good morning.
Hi, good morning.
Good morning.
Sorry. Dr. Batson, I want to find out about aspirin. My mom is one person I know was taking aspirin for years, every day, until one doctor told her to stop taking. Now, a neighbor of mine is doing the same thing, and I told her to stop taking. She said her head feel like it was not her. She could just take it off of the body, and it was tight on her. So I want to explain to me about this aspirin that these elderly people keep taking every day, and my mom is not a heart problem. So thank you very much. I'm listening.
All right, good. Okay, so let me speak in such a way that, yeah, you know, you had to dot your I's and cross your T's when you come into these sensitive topics. So
Yes.
Let me tell you what I can tell you. Aspirin, we know, is primarily a blood thinner. That's the reason why it is recommended, right? We know that it doesn't only thin blood, because a lot of people don't understand that term, thin blood or blood thinners, because you have plenty type of blood thinners. You have warfarin, you have Xarelto, and there are some others, right? Aspirin is usually recommended for a lot of persons. It's primarily sialic acid, and it is a synthetic form of sialic acid. Now, the thing is, you need to be careful with it. I'll tell you that. And I'll tell you why. Research has shown that they have gotten a lot of lawsuits for people taking aspirin. In case you're not aware, they have to pay some money to some people because what they realize, if, for example, you have to go and do surgery, a doctor would have to take you off of aspirin, or you'd have to stop aspirin for anywhere in the vicinity of maybe 6 minimum weeks to maximum, maybe they carry up to about 12 weeks. And the reason for that is that aspirin interferes with what is known as platelet aggregating. What is platelet aggregating? When you get a cut, there is something that forms there, like a blockage, or which we call scab. It looks like, right? That is primarily fibrin and some other proteins in the body that actually form a blockage or a cork to prevent you from bleeding to death. When you use aspirin extensively, your body is not able to do that as it should. And as a result of that, you find in cases, there are persons who have used aspirin and they have ended up with bleeding in the head. They have also ended up with bloody stool, where they have actually seen blood in the stool. And what I have said to you has been scientifically proven and is always is noted, right? So it's not something that the research is out there. Me personally, I have had persons who have come to me, and based on their advisement and my advice, we have found ways of dealing with certain things as regards to them. Because circulation, you see, the thing is, when you're dealing with circulation in the human body, you have to know exactly what it is you're doing. So am I saying to you not to take it? No, I'm not telling you that. It would be irresponsible of me to do that. What I'm saying to you is that you have to track your journey to be healthy. Being healthy is a journey, you know. It's not a destination. A lot of people don't understand that. Being healthy is not a destination. It is a journey. It is a consistent thing. Mentally, emotionally, psychologically, spiritually, you have to be healthy. There are sometimes you'll be physically healthy, good, you know, your body's strong, but mentally you might not be really feel for people. I tell people talk about depression, and I was having a conversation about depression. Everybody gets depressed at some point in time. Everybody. Yeah. Just like jealousy. Jealousy, what Solomon said, rottenness to the bones. All human beings have the capacity to jealous. Anybody who never jealous, who said they're never jealous, you're lying. He's a liar. You're jealous at some point in time. The degree of your jealousy is what makes the difference. So in that same situation, we have to understand that being healthy is a journey, and that journey involves a number of things. Meditation, prayer. I believe I tell people, your spiritual body is the most important body. Take care of your spiritual body, and all other bodies will fall into place. I'm not preaching religion here. People don't understand there's a key difference between religion and spirituality. So as regards to that whole aspirin situation, if you are advised by a doctor to take aspirin, take your aspirin. If you're not feeling well, I suggest you go back and talk to the doctor and let them know that you're not feeling well. That is the responsible thing to do. And if it is you seeking help with circulation, which you were put on the aspirin for, and you're looking for an alternative aspect, that is where your consultation is going to come in, because we would have to make sure that we put you sit down, and we're going to have to go through your documents, go through whatever issue you have, and advise you accordingly. What I suggest to you, I'm big on research. I always tell people, read. Go and do some reading, and you will realize, what is what as regards to that. But there has been instances, serious instances, and recorded cases with persons who have bled seriously, almost to the point of death. Intestinal bleeding, bleeding in the eyes, bleeding in a lot of problems with bleeding. So you need to be very careful. Okay?
We have another question. I was just answering. Some folks were asking, is Dr. Batson live? Yes, he is live. Someone is asking what brand of olive oil to take, and they have heel spurs, and it is very painful. What would you recommend for it?
Okay, if you have very, very painful heel spurs, get a tennis ball. And what you do, you need to do exercise. You sit down and take the tennis ball and you put it under the ball of your foot. And your objective is keep rolling it in small circles under your foot. What that will do is the protrusion that is caused by the excess calcium being pulled from the bone because of the excess acid is going to actually start to go back into place. Now the pain, what you should do, you could soak your foot. Get Epsom salt and soak your foot in a tablespoon of Epsom salt in hot water. Now, warm water, not to burn you. And you soak that for like maybe about half an hour. to 45 minutes, and you do that twice a week. That will help you. Internally, there's a product we have called Inflammation Formula, the Nerve Restore, as well as the Silver with the Mineral Formula. That would help with the calcium and that kind of thing. And of course, your trusted CMOS. Trusted CMOS. Yeah.
We have someone with a very sensitive question here. Good morning. What should a woman in her 30s do about itching in the vagina after her period? Only occurred after having surgery to remove an ectopic pregnancy and happened on and off, but it's happening every month with recent late periods for about 2 months.
Oh, okay. Well, what she needs to do, what happened, because of the ectopic pregnancy, she has, you have hormonal imbalance after that because your body has to be reset. The possibility exists you may have had a little hormonal imbalance before. And then remember, a surgical procedure was done on you. So we know with surgical procedures, I mean, normal thing, you could end up, because they would have given you antibiotics, but you could have gotten some sort of infection. And infections in that part of the body tend to be very problematic to deal with. So it's just a matter of getting it out of the system. Antibiotics wouldn't work. You have to do immune, where you actually boost the immune, natural immune boosting, where the body is now going to fight off that infection. So at Batson Associates, I would recommend you use keep in mind your water should be your body weight divided by 2 in ounces for the last month. If it has not been that, then at least get the Alkagen water and start to drink it like that, right? And then what you do, the advanced chlorophyll, inflammation formula, silver with mineral formula. You use that for 2 months, problem gone.
All right. Someone is saying the brand that you're trying to remember of the olive oil is James Plaganiol.
Yes, correct.
Yes,
that's correct. Yeah, pronounce that like he's a linguist, right? Do French in school.
Good morning. All right. Someone is asking that question. Yes, Dr. Batson is live. Yes, he is live. He's live. For those of you who have been asking, Dr. Batson.
Why does the thing live? They're not here now. Oh, they recorded.
The recording played last week.
Yes.
Someone is asking, does drinking distilled water have any health benefits to it?
The thing with distilled water is primarily water. What's the difference with distilled water, boy? Distilled water, impurities come up, but I believe the molecular, the particle size of the water is very small. So, I mean, you would get some benefit. It's a better quality of water. As regards to how long you could do it for, I'm going to have to do some research because I never really checked it. I know the alkaline water is used as a medical device in Japan. I'm very particular with water. I tell persons, I mean, everything is an economic consequence. So, I mean, everybody might be able to buy water, but at least get a proper filter. You could buy a filter and at least filter the water that you're drinking, you and your family. Do not drink water from the tap just like that. I always tell people that. Yeah, and then your bottled waters, you need to check. And you could check for yourself. There are strips they sell in. They have alkaline strips. You could check it and throw the water in it and see exactly what it is you're drinking, right? But definitely you're going to get some help with hydrating the body in general. That always helps the body.
All right. We have someone saying, good morning, Dr. Batson. Is aspirin, this aspirin thing is true because my neighbor ended up in the hospital because of taking aspirin every day. He's bleeding on the inside and the blood was mixed in the stool as well.
Yeah, so it usually causes, it tends to be very problematic in the gastrointestinal and the central nervous system. Based on the research that I've done, I've seen various reports written when you look at different. Well, I didn't go into the case to look at the legalities of the case because it was something I was doing for a class I had. And but it is there. The information is very, very it's there. So you need to be careful. And there is something to I'll say something just now. And let me just mention this person, Susan Stefan. She says, where can she get good CMOS? We have at Batson Associates. We have a very good source. I had Miss Eleanor. Let me say a pleasant good morning to you, wonderful Miss Eleanor. I hope she's here in the program. Eleanor took the CMOS. She said, Dr. Batson, where we got the CMOS? She said, Dr. Batson, where you get the CMOS? I said, Eleanor, well, I ordered the CMOS. I guess, okay. She said, okay, let me watch this. Miss Eleanor, old school, eh? So Miss Eleanor said, Dr. Batson, I said, Miss Eleanor, she said, Dr. Batson, you have to know if the CMOS would gel properly. I said, Miss Eleanor, you seem to be CMOS expert. So take the CMOS home and make the CMOS soup and tell me. Watch Miss Eleanor bring a big bottle of CMOS soup for me. If you see CMOS gel nice and thing. It's proper thing we get. We get proper thing. So we have available at Batson Associates, and take what I'm telling you all. Use the CMOS. CMOS is a very good thing. It's also very good for the elderly as well. Yeah. You know, all the little aunties and uncles, we want to be around for a little while. We want to be able to move about. This thing where you're hipping good and you can't walk and you're walking with a stick, and the stick don't match nothing, you know. Question.
All right, we have someone is saying, I need a home treatment or home remedy for sore throat.
Well, the thing is, if you have sore throat and it's not for a long period of time, and you can gargle some warm salt water. Home remedy, again, if you have a sore throat. Now, keep in mind, if that sore throat sore for too long, then you should seek some sort of medical advice, because the possibility exists. It could be some infection you get, or it could be some tonsils situation or something like that. Remember, the first line of defense in your body is primary. And remember, things get in your body, your mouth, through a number of different circumstances, right? So it could just be, you know, do the warm salt water for about 3 days, and that's supposed to deal with it. If it persists after that, well, then it could be something a little more serious. You might need to seek medical attention for that. One of the points I was going to make too. Sorry, go ahead. You went.
We do have a call on the line.
Okay.
Caller, good morning.
Hi, good morning. Morning.
Good morning.
Just find out from Dr. Batson what is good for diabetic neuropathy of the feet, where there's tightness and tingly and pain in the feet, like the toes area.
Tell me something. You using insulin? You are type 1 diabetic or type 2?
Two.
You're type 2. And you're diabetic. And you're diabetic how long now?
About 6 months.
About 6 months? Or you find out 6 months ago?
Yeah, I found out 6 months ago.
So the diabetic neuropathy, so the pins and needles cramping in the calves and that's what you're getting?
No, the toes.
Only the toes.
And how long that happening now?
A while about. Well, a while now. I can't remember the timing, you know, but
right.
I've been taking Rubiscort.
All right. There's a product. Yeah, man.
Analgesic cream and so on, but you know, it's still there.
All right. So listen to this. So you get diagnosed with diabetes 6 months ago, you say, correct?
Yeah, approximately. Yeah, the timing might not be correct.
Okay, good.
Yeah.
So you did a test. Is it that you did a HbA1c test and they tell you have diabetes, sorry?
Yeah. Yes, I think it might be more than 6 months. It could be longer than that, but they did a test. I did the test and they saw it was 7.5 or something.
Right. Okay. Right. You're now talking for me. Right. So it's 7.5. So you did a HbA1c. And what medication they give you?
What medication?
Yeah. What medication you taking for the diabetes? Glucophage, diamicron, Dionil. Which one? Genovia, Janumet?
No, as diamicron.
How much diamicron are you using? 1 in the morning, 1 in the night?
60 milligrams, 1 per day.
1 per day. And when you test your blood sugar, how much is sugar does read? Best case, worst case?
Well, sometimes it normally be like 140. Sometimes it goes to 180 something later in the evening, night. Sometimes in the morning it is like 110. Sometimes it is very good. But if my intake of sugar is a little more than usual, it will spike.
Okay, so, and what? Okay, so it would spike. And what is spike? How high?
Like 220, like that.
And when do you test? You test in the morning? What? You test about 30 minutes after you get up? How you test it?
In the morning, fasting, no eat anything.
Right, but how long after you get up? That's what I'm asking. Thanks.
Oh, like half an hour after I get up.
And give me an idea how young you are. Between what, 50 to 60? You don't have to tell me the exact age if you don't want to.
day up.
6 day up. Okay.
Yeah.
All right. Well, the thing is, it's abundantly clear that you had a poor circulation problem before you recognize you had diabetes. But the thing is, your diabetes was around a while. You're more, I would carry you more.
Before I really realized.
Yeah, before you realize, because if you get HbA1c at 7.5, it means that you're having a high for a little while. When was the last time you take a detox?
Why? I don't think I take one for
Yeah, you didn't take that for a while. Right? You need to be. And how much water are you drinking?
Well, I drink the water. I always have a bottle at my bedhead.
Yeah,
I drink it all the time. I get up in the night, I drink it.
Okay, so tell me how. No, listen. So how much water you feel you're drinking? You must be able to tell me how much.
Okay, the size of the bottle and the liters.
No, just give me an idea. So the bottle like what? Like a 1 liter, a 16-ounce bottle, a 2 liter size? What?
I'm trying to see the size of the water. I don't want to put take anybody's
Yeah, you don't have to call Brandy.
ml. I drink like 5 bottles per day.
5 bottles of which ml? The 16 ml?
250 or 275 ml.
Oh, nah, man. You ain't drinking water. Nah. Yeah. That is a small bottle. You ain't drinking enough water. That's 1.250 liters of water for the day you're drinking. You know your weight? Average. Don't tell me.
260 up. 260.
260. Nah, you have some size too, man. Nah, man, you ain't drinking water, Mary. Mary, you need to drink more water than that, man, lover. Nah, love you need to drink more. You have to do better. Yeah, you have to do better than that. So here what you're going to do for me. Here what? We will fix that for you. First thing I want you to do is for the day, try and drink 2 liters of water a day for me. 2 liters. So I'm starting you off slow. 2 liters of water every day. I do not want you with any juice. I don't want you with no soft drink. You hear me?
I don't do soft drink, but sometimes a little juice. Yeah, no soft
Very
drink.
good. You know it have something called quinoa?
What's the name?
Quinoa.
No, I don't know this stuff.
All right. It's Quinoa. That's how you spell it. Q-U.
Yeah.
N-O-A.
N-O-A. Yeah.
Okay, Quinoa. Right, I saw the name.
Right.
Yes,
So
never really,
good.
studied it.
Nice. So here what you do, you're going and study it because that's going to become your friend. So you're going to go in the grocery and get some of that because that's going to help to bring down your blood sugar. Right? So you're starting the water and you're starting to cook that for me. And what you're going to do, God's willing, when you get some time, it have a product we have at Batson Associates called Circulation Tea, and there's a product called Inflammation Formula. When you do your water for that period of time, you start using your quinoa, test your blood sugar for me. Now, you want to see your blood sugar going to start to go down. Going to start to reduce, and we go in so piece by piece. You're going to have to do a cleanse, but we can't give you can't do any cleanse now. You're going to have to drink that alkagen water for like about a month, 2 months, and then do a cleanse. That's the reason why your A1C came up, sir. I wouldn't put you in the, I wouldn't put.
Been done, so the pain and tingling in the feet will go.
Yeah, it will start to go, because that's what I'm saying. Your problem is circulation, but you're dehydrated too. You don't drink enough water. If you tell me you're 260 up, and you're drinking 1.25 liters, the rule for drinking water is your body weight divided by 2 ounces, right? So if we go with the 260 as the amount, when we come down that half a 260 is what, 130? 130 in converted to liters will carry us by more than 3 liters of water.
Okay, then I will drink more.
I'm 200 pounds, I drink 5 liters of water a day.
Okay.
Yeah, so you have to start to do that. So you got the information I tell you, what we're doing. So water first for a month. During the water, go and get the quinoa and start to cook that. You can go on YouTube, look for some recipe. And I don't want you drinking no soft drink and no juice.
Okay.
All right? And when you get a chance and your money running a little all right, you could come and give. It's not all right. You got the circulation tea inexpensive. You could call the office. We'll have those teas at the end of next week, please God, and get some circulation tea and sort yourself out.
Okay.
All right, my dear?
And if someone has cataract, they want to know what they can use.
Cataract, the eye optics formula. Is it?
Yeah.
Yeah, but is it a young cataract or is it a mature cataract? You know?
She said one was mature, one is mature, and the other one is
no forming. Yeah, we dealing with both of them for you. We have some eye drops for that.
Oh, for the mature one?
Both of them, mature and immature.
Okay. All right. Thank you, Doc.
You're welcome, my dear. Take care of yourself, right? Less sugar, right?
Sure.
All right.
All right. So we have, but someone is just asking about cataract as well in the eye. They said it's already the blind eye. Can he do anything for that?
Repeat that, sorry? I didn't hear that last part. My apologies.
She says, the person says, good morning, doctor. For me, I have cataract in my eye and it's already blind. It's already blinded the eye. Can we do anything for that?
Well, the thing is, I'm going to have to get more information because she is saying it already blinded the eye. So I do not know if what she said is based on what was said by an ophthalmologist, or if she is saying it blinded the eye because she's not seeing properly. If you understand what I'm saying. Yeah, who said it? Yeah. So based on, is it based on a report? Is it an OCT scan? Is it that the ophthalmologist is telling you, based on what we see here, there is nothing with your eye? Or is it that you just have the cataract and now visually it is difficult to see? Because it being difficult to see visually as opposed to someone, a specialist, ophthalmologist telling you that you are blind, that is a completely different thing. So I need to know the differentiation. Is it that was said to you, or is it that you saying that because you're not seeing good? If it's the latter, then the possibility exists we could help you. And you have not been told medically that you are blind. Because for cataracts to blind you, they have to be really, 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 really bad. And I don't think they would have been allowed to get so bad because your eyes would have bothered you. So you're going to have to give me some more information where that is concerned.
All right. So we have a call on the line. Caller, good morning.
Good morning, Dr. Batson. I'm calling to find out what chia seed.
Repeat that again. What is?
The chia seed.
Chia seeds.
Seed. What is it to put in the eye?
Oh, chia seed.
Yeah.
Oh, she wants to. You want to know what it's for?
Yeah.
Okay, good. Well, you can listen off, eh?
Okay.
Right. Well, chia seeds is your friend, like most seeds, right? Because they live in. What chia seeds do, they have the ability to absorb 10 times its weight in water. So it's very good for your intestine. So when you use it, it actually expands in the intestine and cleans the wall of the intestine. Quinoa does the same thing too. Chia is nutrient dense, so it has a lot of magnesium, selenium, manganese, calcium. It's actually one of the highest sources of calcium. So it's a very good thing to use, and you could put it in your smoothies. I put it in a smoothie. Or what you could do, sometimes when I would take a tablespoon and leave it in a glass of water and leave it overnight, and it makes like a jelly. And I would take the jelly and throw it in the smoothie. That's so I don't have the seeds, because the longer you leave it to soak, the less, the softer it gets, and it easier. But it's a very, very good thing. And I tell person, just doing things like this could actually add to your life. Let me say a pleasant good morning to Miss Denise Hurst. She is listening to us from Antigua.
All right. It kind of operates like flaxseed.
Yes, it does. The difference with flaxseed, flaxseed is very good. But flaxseed's advantage fall in the category of endocrine system, hormonal. So it's very good for. There was some argument. Like I remember somebody was telling me that somebody had wrote some article sometime and say how drinking flaxseed would affect your prostate. That was utter. That's nonsense. Yeah. When you see those articles, you must look at who writing it. But it's very good. It has lignins in it, and if you research lignins, you'd realize how important lignins are, because they realize that lignins is those fiber. Remember, your body uses two types of fiber. In the realm of nutrition, it's two types of fiber you have insoluble fiber, which is just that it is insoluble, it cannot break down. So insoluble fiber increases the transit time of your bowel movement. So it means, as opposed to having a bowel movement, 4 hours away or 5 hours away, when you have fiber in your diet, your transit time is decreased by maybe about an hour, hour and a half. So it actually helps your assimilation to be faster. That's one. And soluble fiber is what your body uses to bring down or regulate your blood sugar levels, which is why processed food is not good, because processed food has no fiber in it. So diabetics, it is very good that they use the quinoa and they use the chia seeds. Next year, please God, we're going to be getting some, because they have some really nice varieties. I didn't aware. And then there are certain ones that you should use that are a little more healthier than others. So next year, please God, we'll get that. Someone is asking about the CMOS. We do have the CMOS as well. She's asking if she's a diabetic and she has a kidney problem, if she can drink the CMOS. Actually, yes, you can. You should, actually. And with the CMOS, you do like about a tablespoon of CMOS every day. If you're a gym person and you're in sports and all those kind of things, 2 tablespoons. But it's a very good thing for your musculoskeletal system as well as your entire, because you have magnesium, selenium, chromium, potassium, those type of things in there.
We do have a call on the line. Caller, good morning.
Good morning.
Hi, good morning.
Morning.
Me?
Yes, we hear you. Yeah.
Yeah, what I would like to know, what is this? The baking soda, what is this about? And what about if somebody wants to make sure they pass 60 and they can't, but
Sorry.
they want to make sure they don't have no sugar now. And the sugar, sorry, this food somebody about some spina or something.
Oh, okay. Oh, so you now joined the program and you heard something. You understand what she asked? I think she was saying she was listening, but she wasn't here, or somebody told her, and she wanted to know about the baking soda, and she wanted to know about something that could help you if you have sugar. I think that was the question.
Good about quinoa, yeah.
Okay, good. All right.
All right. You can listen off air.
Yeah, hello?
Yes,
Yes, sir.
Go ahead.
I just wanted to know, somebody don't want to get like the sugar now.
Oh.
So what I'm saying, what they can take because
Right. Okay, good. Okay. I like that question, darling. I love that question. Yeah, girl. Yeah, I just be taking. Yeah.
Yes.
Okay, so if you don't want diabetes, here what it is you need to do. Leave the people soft drink alone.
Mm-hmm.
Yeah, sugar. So sugary drinks out of it, because you have to understand sucrose is what? Table sugar. Your body is not, sucrose is very difficult for your body to metabolize. It is essentially poisonous to the body. All right, so you need to reduce that. Up your greens, your seeds, quinoa, your chia seeds, your flax seed. And let me tell you something, you could make these things taste good, People did make it sound like eating healthy don't taste good, That is not true, It's just a little more work. But, so you don't want diabetes, plenty Karaili, plenty okra. Diabetes don't like okra. Okra is very, very good for diabetes. So okra, Karaili, sweet pepper, you want a lot of those in your diet. Try and plate your food out. So when you're having your meals, plate out your food. So plate out means you could have half plate complex carbohydrates or quarter plate complex carbohydrates, vegetables. You want like the same quinoa, and you want some sort of protein. Your protein, always keep your protein lean, but try and have a little protein in your meals, especially as you get older. Because as you get older, you experience something known as muscular atrophy. Diabetics experience muscular atrophy at an alarming rate and much faster than regular persons because of the high level of oxidation in the body as a result of high levels of glucose in the blood. Okay, so as you start to get younger, what you need, and that's why I like the CMOS so much, I tell people it's very good for the elderly, because it actually helps with their muscle mass and the density of the bones and that type of thing. There was a client we had who had some serious problem with her bones, and we let her use that together with the inflammation formula. That's the next product to check out. Very, very good product at Batson and Associates. We never have enough of that. That product really reduces inflammation in the body. It helps with pain. It also helps with cardiovascular problems as well. So you could check that out. Feel free to give us a call or visit. Those telephone numbers for the Shoguana's office, it's 222-8261. That's 222-8261. Debe is the corner of Ramsamooch Trace and the SS Erin Main Road in Debe. That telephone number is 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number is 220-8113. And Tobago is the Triangle Building in Scarborough, Tobago. That number is 226-4553. Again, that's 226-4553. I should be in Tobago, God's willing, on Tuesday, please God. And for online consultations, 868-373-2388. Over to you, sir.
All right, we have another call on the line. Caller, good morning.
Well, what I realized, I didn't touch much about crick. What is that what I asked? Just for the concern and the baking soda.
Baking soda.
Oh, the baking soda. Oh, my Paul, you're marking me, guys. Thank you for that. Okay, yeah. So with the baking soda, so as I said, baking soda is an alkalizer. Chemistry-wise, baking soda is sodium bicarbonate. So what it does, it has the ability to do a number of things for the body. The Italians, when they did their clinical study, I'm going to find that study for you all. And when we finish what we're doing with our websites and stuff, we're going to be posting up all those things. But what they found is that it was really helped in the reduction of inflammatory response in the body. But what it also did as well, it helped with the intestines. Now, anything that helps your intestines, I ride there with you, because your intestines is your master organ. Eh? That's the organ that, remember, that is where assimilation of food takes place and the removal of waste. So you want to ensure that your bowels functioning properly. And there are a number of bowel issues that people have, like things like Crohn's, irritable bowel syndrome, diverticulitis, and those type of things. You get those things because of that imbalance in the intestines. And that's one of the things that the alkagen water does, the santulan does. So with your baking soda, you're looking at about a quarter to half teaspoon in 8 ounces of water first thing in the morning. And you could do that, as I said, for like about 2 months. You could do it 3 times a week. Or in some cases, like if you started, like you do 3 days a week, Monday, Wednesday, Friday. You do that for 2 months, and then you stop for 2 months. It is going to help you. It really is going to help you. All right?
All right, so we do have another question. What causes my son to cough? What possible cause is there that my son would cough when he goes into the shower and when he's brushing his teeth?
Okay, well, I mean, he could cough for a number of reasons. I mean, the change in temperature of the water. Remember, I don't know what type of water he bathes with. If he bathes with hot water, he bathes with cold. Maybe he's a person that if he bathes with cold water and then, you go to bed, you wet your hair, I mean, that whole response could give you a cough. The other one was when he does what?
When he's brushing his teeth.
Well, that could be a number of things. It could be as a result of the toothbrush, I mean, because you're brushing your tongue and that type of thing. If outside of those circumstances, he has a persistent cough or a hacking cough or a cough that has been around for a while, well, then that would be cause for concern. But based on what you're saying, it could just be the motion of what he's doing that causing the cough. But if it's persistent, then we would have to look at things like silver mineral formula, immune formula, teas, no cold beverages. I always tell persons, if you have any respiratory problem, asthma, anything emphysema, anything want to look like asthma and sinusitis, cold is not your friend. I mean, it may annoy you to have to drink, not be able to drink cold things, but it is not. It really, really does exacerbate the situation and make it worse.
Right. Someone is saying, Dr. Batson, what would you recommend for someone who has diabetes and hypertension with a pacemaker and just recently had a stroke and is not able to move his left hand or leg?
Ooh, just had a stroke of blood pressure, diabetes. You need to get some nitric oxide in that body. But I don't know the hydration situation. Okay, so let me see how I can answer this. Okay, so if the person is properly hydrated, and I doubt they are, remember the rule, body weight divided by 2 ounces, the water that they drink. So what I would do going forward, I would reduce the, more liquids in the diet. So give them more liquid nutrition. So I would suggest you get the CMOS and start to make some smoothies for them. So you take off the work of the digestive system. So
that hydration is low.
Hydration is low. Yeah, that hydration is going to low. So you see, the thing is, and that's what I was telling you all at the beginning of the program, right? So what we're going to have to do, we're going to have to work on the hydration Depending on how bad dehydration is, I wouldn't recommend nitric oxide until maybe like about 2 weeks to start to get the circulation, because you don't want them to end up with a neck stroke. Because the thing is, strokes come very close in sequence, you have to be careful. Usually when you get strokes, sometimes people get mini strokes within those big strokes and don't know. So I would work on the hydration first. And when you get that hydration up to like about the first month, then we could start to work with that individual. But from the aspect of dietary now, you want more liquid nutrition in the diet. I would suggest you there's a product that you could use even without dehydration or with dehydration situation that's going to start to help the circulation. There's a product with resveratrol. You could always call the office and ask them about it, which would be 1 tablespoon in the morning in 8 ounces of water and 1 tablespoon in the night in 8 ounces of water. Let them use that for a month, and then after get back to us. But as I said, from the dietary perspective, you want the diet to be obviously healthier now. No dairy, no milk, no cheese, no butter. Reduce the sugar, and start to work on that situation, because you don't want that person to get an neck stroke. Okay.
All right. The person with the son who has the issue with coughing,
with the cough, right?
They say he starts to cough as soon as he enters the shower room, before he goes under the water.
Still, it could be change in temperature. Remember, your bathroom carry a different temperature, and changes in temperature could affect breathing and coughing and that kind of thing. So I wouldn't make a fuss about it if it only happens there. I mean, if outside normally. So it has to be something in the environment, possibly, or as I said, the change in the temperature or whatever the case may be.
Mm-hmm.
Yeah.
We have another question here. Is there anything for fibroids disintegration without surgery?
Yes, we do. There's a product we have called Uterine Plus. There's one that we have as well called Women's Formula, because fibroids are caused by a number of things. They are caused by lack of circulation in the uterus. The castor oil is very good. I like that, where you get the black Jamaican castor oil. You mix it, 1 tablespoon of castor oil with 1 tablespoon of coconut oil. You heat it, not to burn you, and you massage the womb area by your groin area there. That's very good. That's very good for women. It's very good for your breasts too as well. Women who want to avoid breast cancer and want to maintain proper breast health, you could actually put that on their arms and on your breast, but not on the nipple of your breast, because of the cancer. But what that does is actually helps to improve lymphatic drainage in the body. And it's lack of lymphatic drainage that causes women to end up with breast cancer. It's also very good for men, for the prostate as well. So it's very good to help in draining the lymphatics very close to the prostate and helping, to remove a lot of toxins and that type of thing. I remember there was a client who came to us who had stoppage of water. And that's one of the things that we gave him to use. He had a catheter. And we gave him that to use together with the Santulan, the Alcogen water. We also gave him the inflammation formula. And in about 3 months' time, we were able to have the catheter completely removed. That's what you want. Right? So those of you, if you have catheters and you want us to help you and you listen, you follow instruction, very important. Don't send no hardened people for me. They will not last a day with me. Right? We're going to help you get some help. So I don't know, based on our time and how we're going, so you remind me. So I remember you keep in time.
Yes.
You
we have just about 15 minutes again. The person with cataract issue who said the cataract caused blindness in the eye, they said, yes, not seeing at all, only seeing shadows. That's what I think. This is the same person with the cataract is asking. Yeah.
Just not repeat that. My apologies. What again to me?
The person with the cataract in the eye.
Right.
Caused the blindness.
Right.
And was asked if there's anything that they can do. They said they're only seeing shadows in the eye.
Oh, so based on her assessment, she's saying that she's blind. Oh, okay. Yeah. Well, the possibility exists we can help. But the thing is that cataract would be way advanced. For you to be seeing only shadows, that means there's an advanced cataract. Whoa.
It was
left on check manual. Well, we could do that. There's a specific eye drop that we use for mature cataracts. I don't know off the top of my head if we have right now. I know we have eye optics. We have eye optics. We have gotten MSM, but I believe that one specifically for the cataract, I think we are expecting that. We should have that by the end of the month, God's willing. I'm not too sure When you call the office, just ask them, and they'll be able to guide you accordingly.
All right.
Yeah.
We have a caller on the line. Caller, good morning.
Good morning. You know what I would like to know about having a brother in my church.
Can you
either take off your radio or
Esther, can you load down the radio, please?
Esther.
Yeah, what I would like to know about somebody in my favor, he has this problem with his heart. I think they have a pacemaker, and they had COVID and something else. And I told them that I will let them to come by you and know who's speaking to you.
Yes, my dear, how are you doing?
Yes, okay.
Right.
So, I have another neighbor, he can't run into, but it's just the situation, my feet. I'm about the problem with my feet now. But by chance, I just had no question to somebody with the heart situation because in the cancer. Do you have do you want to drink now? Or just say you don't have thing now?
Which one is that? Something that you was using before?
CMOS. She's asking about CMOS.
Oh, we have CMOS, but the one that is unprepared, the one that is already cleaned and everything like that. But yeah, we have.
No, they're not. I like to make sure. But I just asked this to person and decided I'm not going to make it look like before. So, but I would like to know about two things that somebody now. I told he has because my brother he has a situation. He has a problem. He has something in his heart. I think a pacemaker, and I think to show you that. So I just have asked him, and I'm a neighbor with
all right, well, okay, good. Well, no problem. Well, what you could do is give them the office number and let them call, and we'll just organize accordingly. They come for a consultation, and we go from there.
No problem. Thank you very much. Yeah?
Yes, my dear.
You too. All right, we have someone saying. All right, we have another call. This business quite persistent. They've been trying for a while. Good morning, caller.
Hi.
Hi, good morning. You're live on the air with Dr. Batson.
Good morning. What I want to find out is your pressure tea.
Right.
You said you can take if you have high blood pressure.
Right.
Do I have to take all two together? Or do I have to eliminate the tablets? Stop taking the tablets, that is.
Okay, good. You could listen. This explanation will be a little you could listen off here, okay? All right, good.
All right.
Okay, so rule of thumb. You're not supposed to stop your medication just like that. Rule of thumb, right? Good. Now, the thing is, but you're looking to get help. You want to improve. So my thing is, if your lifestyle brought you in that place, then it means your lifestyle could take you out of that place. So once you to make a lifestyle change where we start introducing things like exercise, we start introducing things like the teas and that type of thing, it means the blood pressure is going to start to go down. So the most important thing that you have to do is do what? Monitor your blood pressure. So you're checking your numbers daily. And once you check your numbers daily and you realize it starts to go down, then we're going to start reducing the medication. That's what you want. Because I've had clients, like, for example, there's someone who came to me who had hypertension, and I recommended some stuff for her. But in what I saw, I said, your main issue, she had a problem with fat metabolism in the body, which means she didn't exercise. I say, you are too inactive. And because of this level of inactivity, your body is holding on to a lot of fat, and it is interfering with your circulation. So I put on an exercise program. I told her, you go to a gym, get an instructor. I instructed the instructor. Well, not instructed the instructor, my apologies, advised the instructor what it is, he should focus on and whatnot. And in a month time, she was able to stop the medication completely. And that has been, what, about 2 years? So the thing is, common sense make before book, right? But you could only manage what you measure. So it is imperative as a diabetic and someone who is hypertensive, when you start to do any sort of improvement, whether it is with nutrition, proper hydration, because just drinking water, more water than you used to drink before, your proper amount of water, going to start to regulate your blood sugar. What would you do, or your blood pressure? What you'll do, drink the water and take the medication, and your blood pressure and blood sugar go too low? No, can't do that. So you have to manage it. So you need to check, and in checking now, we're actually able now to reduce. So if you're taking a 50 milligram, you can now take two. If you're taking 250 milligrams, you're now taking 150 milligram. And so you go until you are in a better place. Simple, simple common sense. All right, so I hope you understand that. Must always monitor your blood pressure and your blood sugar, especially when you're starting programs like what we offer, because the number, it is going to go down. I'm telling you, it is going to go down without a shadow of a doubt. So we don't want it to go too low. So it is just a matter of monitoring, and then we reduce accordingly. And that is what we have feedback for. That's why I think call the office, let them know, or when they do your feedback, you could always let them know. Call any one of the consultants would be able to speak with you, or I myself, if I'm office, I have no problem, I take the phone and I'll let you know exactly what is going on. Keep in mind, communication is important, very important. Yes, sir.
Someone is saying they just joined the program, and if you could repeat the formula for water intake.
Oh, good. So the rule for drinking water primarily is your body weight divided by 2 in ounces. So how much ever you weigh, you divide that by 2. So for mathematics' sake, let's say 160 over 160 is 80. Your basic water requirement for the day is 80 ounces of water. I believe that converted to liters will carry it to 2 point something or something. So anyway, we have about 2-3 liters of water for the day. Now look how light that person is. Compare. I weigh what, 200 pounds? Half of that is 100. I drink 5 liters of water for the day. So imagine if you're over 200 pounds. And you're drinking. So there are a lot, and this is not to make anybody feel any kind of how, which is why people, when they are obese, that is why you have so much of problems. Because most obese people, because of that size that you're carrying, if we were to go with the formula, you see how much water you have to drink? Most people with that weight do not drink that amount of water.
And I think you need to reiterate what you did last time with temperature of water. Because people think, all right, well, yeah, I'll do that with cold water.
No. Cold water is very detrimental. In fact, I don't understand why people don't understand that. What in cold water, like, all themselves so accustomed to, they can't stop drinking that by? No. People don't understand that if you drink water cold enough and your body temperature is of a particular temperature, your heart can stop, literally, You're going to give yourself, a lot of people, the problem with a lot of us that we don't know, some people know and some don't care, and good, I have no problem with that. But some people don't know. There are things that you do. A lot of people do not know when the nutrition. I remember getting a client who had children, nice young lady. She had 2 children, and this is her mother, single mother, and she's feeding her children daily. And this lady didn't realize she was poisoning her children, She genuinely did not realize. And it was the food. The sodas and the snacks, and she said, the children always, they have to get the snacks. I said, no, Miss Lady, snacks, buy a fruit. So I'm the banana, and apple, and grapes, or local mango. So people don't, children don't eat them thing again now. Everything in a bowl. No, that's why they're sick. So that's why I see some kind of disease. I tell somebody recently, my youngest stroke patient is 14 years now.
Wow.
My youngest arthritis patient is 16. The youngest diabetic I have is 6 years on insulin. Well, they came to me on insulin, they're not on insulin again. Trinidad and Tobago, no, we had to do better than that.
Wow.
I dealt with a 16-year-old who was recommended a hysterectomy. You can imagine, you're so unhealthy. Well, I mean, she wasn't that unhealthy, but she was bad. She was really bad. Now the doctors say, hey, hear what? No children for you, hysterectomy. Her mother come by me. She said, Dr. Batson, I can't deal with this. And listen to me, it was the diet. That young lady eats meat and meat alone. You can imagine your bowel movement. You go in the toilet once for the week. Nah, man. Wow. So Trinidad, don't give yourself those type of problems. As I tell you, do not lose your power. Do not hand over your authority to people because you have ill-treated yourself. Because when water more than flour, you have to go with what the doctor. And if you're under surgery, you could go in there for one thing, and because everything fused. I know quickly someone who went to do a hysterectomy, and it was just to take out the womb, and they wanted to leave the ovaries, but everything was fused. The doctor had no other choice but to take out everything.
Yeah.
Yes, sir.
All right, so we have someone asking a 2-part question. They say, good morning, 2 things. My mom feels as though a lot of pins and pins are sticking her in her hands, and sometimes, especially when she's doing something like plaiting hair. What could this be? And the second thing is, I have fibroids and started to get excruciating pains in my lower right abdomen for a few days and only passed. And it only passed when I took painkillers. What might this be?
Okay, so let me see if I get this. They had excruciating pain, they said, in the abdominal. And they said they have fibroids, right?
Started getting pains
right.
in the lower abdomen.
Yeah. No, you see, that's the same thing I'm saying. So this lovely individual know that they have fibroids. So the thing is, if you're getting excruciating to the point where you have to take painkillers, that could mean a number of things. Those fibroids are getting bigger. They are pressing on different things. So it could be starting to press on your bladder. It could also be the presence of a cyst. Because most people, when you have fibroids, you don't only have fibroids alone. Some people have fibroids, cysts. You have different type of cysts. You have Nebotian cysts. You have different cysts that women could get. And that area is very easy to get cysts, especially if you have poor circulation in that area. That's why I was telling persons with the castor oil and the coconut oil is very good for lymphatic drainage in that area. The reason why most women have gynecological problems and polycystic ovarian syndrome and adenomyosis and ectopic pregnancies and infertilities and those and those type of things is because you're not getting proper circulation and oxygenation in your womb. And anything that is not getting oxygen, what happens to it? It begins to die. Yeah. So that is a serious situation. I would not lapse on that. What I suggest you do an abdominopelvic ultrasound, what is referred to as a abdominopelvic ultrasound, and they will be able to see. So we'll know size of the womb, location of fibroids, type of fibroids, whether it's intramural, whatever the case may be, and then we're able to work from there. Because you don't want to reach the point. That's what I'm saying. If you leave those things long enough, it reaches a point where it can now cause problems. It could rupture inside of there. Cysts could open, and you could die. Because if a cyst rupture in the human body, most of the time you die. Because that is so septic, you end up with sepsis, and it basically poisons you. So you need to be careful. So ultrasound, and let's see if we could give you some help with that. Watch your water intake. That's one of the things I would advise. And start drinking hot. Drinking your water hot, like tea. Okay, so women who have fibroids, this is one of the things that you should do. In the morning and in the night, drink hot water. But you know what I mean? As hot as you could take it. In terms of what that is going to do, the thing is, fibroids doesn't like hot water. In the sense that what it does, it changes and it encourages the metabolism. Fibroids don't like this thing too as well, fasting. So start to do some intermittent fasting. You could fast like maybe twice for the week. You could do the 12-hour fast. You could always contact us and we'll dot our I's and cross our T's for you where that is concerned. The cyst and fibroid formula is a very good product. Women's formula is exceptional. We have women's formula. We have female balance. Those two products are very good for things like menopause, PMS, anything to do with hormones, hot flashes. The ladies who tend to be moody, and especially this weather and your husband talking to you and you're really taking them on, we are thinking for that too. Because you have to fulfill your vows. Don't be parking up on people there. You have to fulfill your vows. So we have things for fulfillment of vows as well.
Yes. Security marriage.
Security marriage.
We're just out of time.
Yes.
And I know persons that are still messaging. Are you doing any lives this week that persons could ask their questions in?
Yes, we are doing lives. What you could do, those of you, we usually have a live on a Thursday. We have a live on Thursday from 11 to 11:30. That's 11 to 11:30. Of course, for professional reasons, I cannot call the frequency, but that is our next frequency. But we do lives for all the frequency that we do, right? So one is Thursday from 11 to 11:30. Then we have one from 1:15 to 1:45. And then there is one from 2 to 3 p.m. So you could always get that information for that. And of course, those of you could always Add us on Facebook. On Facebook, we are Batson and Associates Limited. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Keep in mind that number for the Chagonas office. You can give us a call on 222-8261. That's 222-8261. Debe is the corner of Ramsamouch Trace and the SS Erin Main Road in Debe. Make sure and call those numbers. Get your Santulan, especially for the holidays, your Alkagen water. If you're having problems to sleep, nerve restore, blood circulation to the brain optimizer. Teas we would have from next week, please God. So circulation, prostate, kidney. We have a tea for everything. Okay? And as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless. Sir, always a pleasure. Till next week, please God, sir.
Definitely.
Yes, Facebook. So you all saw that. So we have some work to do. Those telephone numbers again, 222-8261. Debe is the corner of Ramsamouch Trace and the SS Erin Main Road in Debe. Like us, share us, leave a comment. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Also, look out for our specials, the pensioner special, the 2-for-1 special. We also have our Christmas special coming. Okay, up and running. And look out for those products, your Optimizer, your Omega with your astaxanthin. We have our Advanced Omega and so many other products. So, till next Thursday, God's willing, take care, God bless, be safe in this rain, those of you who drive in, and until next week, take care of yourself. Bye-bye.